disease.
And what did these records, how did they enhance your opportunity to diagnose Mr. Wilson?
Only in that he'd been diagnosed with major depression, bipolar disorder.
Hey guys,
and
anybody
treated
here?
for these disorders for years of being in prison. Or
Anybody here? Anybody
jails,
here?
for that matter.
Was he also treated for schizophrenia?
He was treated for schizoaffective disorder.
I see.
That's another psychiatric diagnosis he had obtained. But there were no head injuries within the records.
Did you have an opportunity to evaluate some gross testing material provided to you from Dr. Eisenstein?
Yes, but as I mentioned, I'm not a psychiatrist or a psychologist, and that really
What are
didn't
you
make
thinking,
sense.
guys?
Okay, so it didn't assist you at all.
No.
All right. After you had conducted all these tests and you'd reviewed
How is
all these
everybody? What are we
records,
having for
did
breakfast this
you
morning?
prescribe any further testing for Mr. Wilson?
I have my flavored coffee.
Due to his self-reported head
Good morning.
injuries,
Good morning.
as well as some physical findings that support the potential for traumatic brain injury or head injuries,
Much love from
I ordered testing.
London.
What tests did you order?
All right, mate.
I ordered a MRI of the
My
brain,
needs, bad girl.
performed on a 3T MRI
Thank you.
with DTI, that's diffusion tensor
I had a
imaging,
good time on that chat last
as
night.
well as neuroquant.
I heard that Katie Joy might be
I
coming
also
after me.
obtained a CT PET FDG, fluorodeoxyglucose,
Welcome,
in order to
Nanda.
assess function of his brain.
Green tea.
Okay.
That's Holly Jolly's
Were any of
favorite.
these tests performed?
The MRI of
Andy
the brain
Dodson. Raisin
and
bran
the DTI were
crunch.
done.
I've never had that, but I like a
Neuroquant was
raisin
not
bran.
done, nor was the CT PET, the FDG CT PET.
Okay. Were you provided the results of these tests by
Green tea.
Gulf Coast Medical Center?
I was.
And did they also include
Rice and
some other
eggs.
tests that
I
had
could do rice
previously
and
been
eggs. That
performed
sounds
on Mr.
good.
Wilson?
Sounds good.
Yes, a CT scan of his head done the year before.
Tea for two. I
Did
thought
you
it said tea
review
for
the
two,
CT
Linda.
scan?
Yes.
And did you find it of any value in your diagnosis?
I'm gonna have to try raisin bran crunch.
The CT scan showed no evidence
Thank you,
of acute
Jennifer's
hemorrhage or
Heaven Sent
stroke,
Reborn
as the report
Nursery.
says.
That's a
But you can see
mouthful.
some lateral asymmetry on this CAT scan as well.
So, guys, what do
May I
you
have a
think's
motion?
gonna happen here? Starbucks espresso with cream. He might be grandfathered in. He might not be sentenced because he might be grandfathered in. You know, when he committed the crime, there was no death penalty for what he had done, right? Brenda Michaels, I'm glad you are here. Sonia 69. And everything bagel, that's the thing. Bagel, 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 bagel. Just Jennifer is fine. Way too smug, way too smug. That's my friend texting me. I'm sorry, my friend. I'm so sorry. Listen, I'm in the middle of a live stream. You want to be part of that? Why does this man always look smug like an idiot? I don't know why he looks that way. Ooh. What happened to the volume? Is there volume? You guys hear anything? Because I don't hear anything. Do you hear me? Do you hear me? Why can't we hear this guy? What happened? What happened? We hear me. Okay, but nothing on that end. Let me see if I can go to Law and Crime and see if they're talking over there. Let me see if it's my fault, my problem. They're not talking over there either. No sound. Yep. Everybody's writing no sound in the Law and Crime thing. So it's not us. Hi, Kathy Hannah. I have concerns about this doctor. Has he taken the test? So apparently they've taken the test, but I don't think that they found anything. But I think he's going to be grandfathered in, unfortunately. I'll be surprised if he's not. You know, by rights, he should be grandfathered in.
The screen and point.
There we go.
Yeah, I'm sorry, you're gonna have to speak up louder or
Yell,
come back
buddy,
to the
yell.
microphone.
This is the left lateral ventricle. It's slightly bigger than this ventricle. That's called ventricular asymmetry.
Okay. All right.
Anybody read lips?
Is there any way we can move a microphone closer to?
Yes, please do.
Or-
You guys should have been better prepared.
I don't know how far that one comes out.
Speak up, matey. Morning, all. Carol, how are you? Yes, grandfather would be life. He loves licking his lips. He thinks everybody's into that. When they slammed the door on him today, I want to be an incarcerated fly on the wall.
Oh, we can turn it on. Is that better? Oh, there it is.
Yes,
Okay.
better. Let's go.
Okay, I don't know if anybody can see this, but I measured the ventricles to show that there's a difference. NeuroQuant is very helpful at showing us asymmetry because it measures this stuff, but we had no NeuroQuant. So I measured it myself.
Thank you, Pinna Rose, on your
On the right side, which is your left, here, that's 3.55 millimeters. On the right side, that's 5.6 millimeters. So that's quite a difference in the ventricle size from one side to the other. Next slide. And here you can visually see it where the left or the right side is bigger than the left side. But also I'm going to point your attention to all the space here. In my opinion, his ventricles are very small for his age.
But what is the purpose of the ventricle?
The ventricles are the space inside the brain where cerebrospinal fluid is.
YouTube streets. How you
The
doing?
size indicates if
Guys, you
there's
guys got to
too much
check
water
out
in the
this
brain or too
channel.
much
You
brain
know
in the
that,
brain.
right?
His ventricles are too small, which tells me that he likely has a pretty good sized brain.
Lisa says, I know his brain's screwed up.
Which is why any amount of atrophy in it is significant.
Kathy says, man, that shit's from drugs. Hey, YouTube streets.
The space, you're looking at space all around his brain. Nothing. Space in between.
You mean he ain't got nothing in there? It's
then up
all
in
empty
front.
space, buddy?
You see the space. The space in front of his brain. So that indicates some frontal lobe atrophy.
I don't think he's
Not
going
a
to
lot
get
of
it either. I
atrophy.
think
He's
he's
got
going to be
some frontal lobe
grandfathered in, YouTube
Next
streets.
slide.
I really think it will be the
Back to the ventricle.
grandfathered thing.
This is another location just to show that I'm not just picking cherry picking. Is right, which is on your left, is 8.03 millimeters. On the left, which is your right, is 9.48 millimeters. Note this is all less than a centimeter.
Leave your DNA on the like
Again.
button in case we need to find you.
Here's left frontal. I'm gonna get back to that. Left frontal.
That was good. Can we pin that? Wait a minute. We got to
Yep.
pin that.
All right, now we're gonna start talking about atrophy.
What is atrophy?
None of this
Atrophy
excuses
is where
what
the
he
brain
did.
shrinks and pulls away from the skull and creates more spinal fluid on the other side of it. His brain has really no atrophy other than in certain locations. And where you see it is right in here and right in here. This area is where the amygdala is and the hippocampus is. The amygdala is part of the limbic system and hippocampus is part of your memory centers. His memory on the MoCA was, he had 1 out of 5 on the
Look at how
recall.
he's just sitting there. Like he's at a
so
ball
atrophy here,
game or something.
And then we start seeing the anterior frontal lobe. You don't even see brain here yet. You just see spinal fluid. Next slide.
If he has the ability to
Next
commit these
slide.
crimes,
You
it shouldn't
see the
even it
space
shouldn't
here,
even matter. It's pure.
space in
I
between.
agree, Mando.
And the space between here. is more
Thank
than
you,
the space over
Jennifer.
here. And that's your orbital frontal cortex,
His scan is drug
part of your
abuse.
frontal lobe.
That's what Jay Rader says.
Some atrophy, not a ton of atrophy, some atrophy. Okay, this is a color picture. This is
So
our
how many people
DTI.
want that photo?
Let me get
How
over
many
here
of
so you
his
can-
army do you
Okay.
think want that photo
You can move
autographed?
the microphone with you.
They could sell that bad boy for $100 each. Call it a
So
piece
we're
of art.
looking at here is
Let me interrupt you a second. Using some initials here, what is DTI?
DTI is diffusion tensor imaging.
What's it designed to show?
They
Axonal
need better
interruption,
microphones there, yeah? Better
directly
microphone.
from traumatic brain injury. However, white matter lesions from like strokes can cause that to be abnormal as well. But I can tell you that he has no white matter lesions on his brain.
He's got on his orange prison jumpsuit. But shout out to Jumpsuit Pablo who got that
That
going with his
the-
long johns. There
The
you go.
green indicating flow of axons is greater on
And he's got
one
his
side than the
socks,
other.
his
There's a
jumpsuit
paucity of it on this
tucked
side.
into his socks because it's a cool
The
look
next picture is even a little bit
with
better.
those orange jellies.
Here we go, green and blue,
I'm having jail
Really got nothing
flashbacks
over
when
here
I
other
worked in the
than-
jail.
a little yellow.
Everybody was orange. That's what the trustees used to wear was the orange.
So
I
this
think
tells
that's
us that we have some
switched
frontal lobe
up.
damage. I think that's it.
Diet Dr. Pepper and you're ready. Come on, Don Woods. You're late to the game, but they're just going over the scans. We really don't know what's going on. That's what I'm saying. He sits all Ushka Sprout. I dare anybody to repeat what I
So-
just said.
If we put all that information together, what kind of conclusions did you come to as regarding Mr. Wilson's his brain injuries?
There are two basic conclusions. One, with the ventricular asymmetry. Ventricular asymmetry can be a normal finding, but in the setting of psychiatric disease, it indicates cognitive and emotional dysfunction.
Okay, how does that manifest itself in somebody's conduct?
It's going to cause worse behavior. It's going to cause less thinking. It's going to cause less likely to modify your own behavior, basically.
What was the other one? You said there were two.
Hey, Julie.
Evidence of some brain injury.
Amelia.
The atrophy of his superior anterior
Lisa.
temporal lobes, as well
Lamb
as
chop.
frontal lobes, is a important combination.
I agree with that, lamb chop.
When you have atrophy of your amygdala, which is one of your main points of your limbic system, it creates for emotional instability. It makes you more likely to get mad and not be able to calm yourself down. The frontal lobe impairments cause one to be more likely to be impulsive and act without regard to consequence, act without plan, more likely to be irritated and agitated. And the frontal lobe is also important for stopping behavior arising out of your temporal lobe.
Is it practical to assume that these injuries to the brain occurred contemporaneous with the traffic accidents?
The
It'll look good
location
on
of
you,
this-
Julie,
of
but
at least
we
the
don't want you wearing
atrophy
that.
Is typical
Of the what? I'm sorry.
of the atrophy, the shrinkage,
Okay.
where it pulls away from the skull, is typical of trauma to the brain. That's where the skull is the hardest, and that's where it beats up on the brain the most.
Bad girl, I don't
So
know.
if Mr. Wilson has been in custody since the date of his arrest, which was 2 days after the incident, presumably.
Good morning,
he
Rebecca.
had this same brain injury back in 2019.
Yes, but atrophy takes time to develop. It didn't just occur in the last year. It's probably been occurring over the last several years.
They're just
Is there
going over
anything
the
that can be
scans,
done to
Rebecca.
repair or replace?
No, but medication can be helpful at modifying his behavior, mostly from psychiatric disease, because this isn't somebody with this injury on top
You
of
got that right, kitty, kitty, bang, bang.
bipolar disorder, major depression, schizoaffective disorder, whatever
Julia,
it may
you're
be.
right.
It's going to make it worse. So if you at least treat the psychiatric disease, and basically a simple answer is this can be treated.
Okay. So
Well, let's give him some pills and let him back on the street.
problem that you have
Hey,
described
Julie.
as a result of the brain
Hey,
trauma
Julie, there's
is
two
separate and
Julies right
distinct
there.
from the psychiatric diseases that he has.
Yes. Most psychiatric diseases don't have a MRI finding say, hey, you have this disease. Schizophrenia, they're starting to see some findings of some commonalities between MRIs and PET findings, but nothing's been established as this is it.
Okay. So this is basically in addition to anything that a psychiatrist or the
He'll be sentenced
neuropsychologist
today,
may have
Pixie.
testified to.
Yes.
May I have a moment?
You may.
Yeah. So listen, I just want to go on record to say that I don't think he's going to get the death penalty because that wasn't in place when he committed the crimes. So he would have to be grandfathered in. And I think that that would be a hard thing for that to happen. The sentencing is
Good morning,
today
Doctor.
at 2:00.
Good
We're
morning.
going over
Now,
the
you indicated you had an opportunity
result.
to sit down and
Good morning,
meet
Tammy.
with Mr. Wilson, and you conducted a series of tests. Is that right?
That's correct.
What internal validity measures were in these particular
Oklahoma
tests?
City.
The MOCA does not have any internal
I
validity
lived in
measures.
Broken Arrow, Oklahoma.
However, I
Nobody
find it
knows that.
difficult to
That's a
believe that
secret
someone would
for a very short period
fail
of time.
two parts of it and do excellent on everything else. But the parts that he failed in were the things that the MRI supports that he'd have impairments with.
Okay. Well, I'm asking you specifically about the
I know.
screen nerves tests, the motor exam tests, the muscle tone, the sensation, which is your deep 10 reflexes, and your assessed Romberg tests.
What about those?
Are there any internal validity measures in those particular tests?
Well, reflexes, I like to see someone fake it because that's not something you can really do. I mean, I've been in this for over 20 years. I've seen people try, but you can't fake it. Motor examination, you can also see that too. There's actually built-in validity testers when you test for leg weakness.
That's correct. He's still
But
in
he
county.
exhibited no weakness, so I had no reason to believe
Yes.
it was invalid. Tone,
In Lee County, I
he
believe.
doesn't know what I'm checking for. How's he going to fake
Is he in Lee County? Maybe he's not.
Well, my
I think
question
he's
to
in
you
Lee
is,
County.
You conducted these as forensic exams, did you not?
I did.
And forensic exam means that it's an examination by a medical professional for the use in a criminal prosecution. Isn't that right, sir?
Yes.
Okay. And because of this is a forensic examination, you would agree with me that Mr. Wilson has an interest in the outcome of the evaluation, does he not?
He does.
Okay. So continuing on, you conducted these screen nerves, the motor exams, the muscle tone, the sensation, the assessed Romberg tests, sticking someone's tongue out, making sure that their face is symmetrical, making sure that he can smile, whether or not he can shrug his shoulders.
Nurse scratch it.
Those are
Yeah,
all
right.
things that you took into consideration, and that is based upon Mr. Wilson's cooperation with you, is it not?
He's gonna still have
Those other
money.
things were normal too.
Now,
He's gonna
when
get
we
his money,
to the MOCA examination that you
but
had
he's gonna get
previously
his ass
discussed, that's the
walloped, and
Montreal,
he's gonna be extorted
cognitive assessment test, correct?
Yes.
if he gets in general pop
And
because
when we were discussing the Montreal cognitive
he's supposed to
assessment
be a
test,
bit
you
of a
would agree
wussy
with
when
me,
it comes
sir,
to
that
men.
particular test is specifically a screening device. Isn't that right?
And now all the inmates
It
know
is a
how much
screening
money
device,
he
yes.
has.
And that screening
This
device
is
was
experience
something
of
that you've
knowing
gone
what
ahead and
that's like
utilized in this
for
particular
the
case. Is that
inmates.
right?
It is.
You gotta love it.
And are you certified in
Prison
utilizing
punishment.
that particular test or assessment?
I am not,
Okay, why not, sir?
I heard that too, Dawn.
because when I signed up for that doctor who runs its program, I couldn't get into the system when I paid my bills. Like a week later, I got my access, and I haven't done my access yet. But it's a racket.
I'm sorry, did you say it's a racket?
It's a racket.
All right. Well, isn't it in fact true, sir, that the people who went ahead and developed the MOCA assessment, sir, they actually encourage that successful completion of the official training and certification is mandatory for anyone administering paper based on MOCA tests?
Let me get my.
That guy just insulted like a huge team of
I
doctors
paid some like $200 for this thing.
and inventors on this. Listen to this. Gen Pop. Yep.
It's run by the founder. But it is accepted. So certification thing is relatively new.
But you've not been certified, is that right?
No, but I'm working on it.
All right.
I agree, Dawn.
Well, as far as the Montreal Cognitive Assessment Test, you also acknowledge the fact that there was no internal validity measure as it relates to that particular test. Is that right, sir?
No, but it needs to be
No,
interpreted in the
Julie, I
setting of
didn't.
everything. And given where I see atrophy, it seems like it would be a valid indicator of his performance. His memory's terrible. He has atrophy in his anterior temporal area.
He's getting $400 an
Executive
hour
function
for
impaired.
this.
He's got frontal lobe atrophy. So it makes sense to me.
Well, you'd also agree with me, sir, that the internal validity measure is to
I
determine
worked
whether or
with the
not someone is
inmates.
giving a
I
good
worked with
effort.
them in the
And to do that,
kitchen,
no
in the
determination whether or
commissary,
not
and
Mr. Wilson was
taught
giving a
them
good effort when you conducted the
basically
Montreal
how to
Cognitive
work
Assessment Test,
if they
correct?
got out or when they got
Correct.
out, so that
Other
they'd
than
have
his
some
performance in
sort
the
of
rest of it
work
was excellent.
skills,
He did serial sevens
as
without any
well as
difficulty. He
running the
remembered
kitchen
word
and the
had word
commissary and the
counting,
jail
or
system.
He was able to tell me
And then
12 words in 1 minute that started with F without difficulty.
later I worked with
That's usually
juveniles
somebody,
in
if
a
they're gonna take it, they're not
residential
gonna get there.
setting as a
Well,
counselor,
isn't it in
just
fact true,
as
sir,
a
that Mr.
counselor,
Wilson has some
and
issues as
coming
it
up with
related to the
groups and
memory
stuff.
function,
That's what I did.
portion of the Montreal Cognitive
$400 an hour to sit there and disagree with
Say that one more time.
something or
Is it
agree
in
with
fact true
something.
that Mr. Wilson had some memory issues as it relates to the testing of them by and through the Montreal Cognitive
How come
Assessment
it's so
Test?
low?
Yes, on delayed recall, he had 1 out of 5.
Now, how do you know whether or not Mr. Wilson actually remembered more without any internal?
I'm not. I'm
validity
in New
checks?
York, about 4 hours away from
I don't know
Canada.
that.
So would you agree with me, sir, that the Montreal Cognitive Assessment Test is not as good a measure of whether or not Mr. Wilson has a good cognitive development than those that were conducted by Dr. Eisenstein?
Eisenstein did a 6-hour battery of testing, which is going to be superior to a MOCA test.
And are you familiar with the neurological assessment that Dr. Eisenstein conducted upon Mr. Wilson?
Dr. Eisenstein did neuropsychological
Good for
assessment,
you, off
and
grid,
all I had was a
simply
raw
happy
testing and no
Rodriguez.
report.
Good for you, man.
So no.
Were you aware of Mr. or Dr. Eisenstein's testimony in this particular
Maine's
case?
I
beautiful.
was not.
Are you familiar with the fact that when Mr. Wilson
He does, right, Julia?
conducted or underwent a full neuropsychological evaluation with Dr. Eisenstein, that his executive function
You're in the south tier of
in
New
6
York.
of the 8 tests was normal?
I'm in the Hudson Valley.
The 6 out of 8.
Lisa, somebody's
suggest
going to cut
anything?
that thing right off his face.
Is that any impairment? Is that absolutely normal? I don't know.
He had executive
Grateful
functioning
Graham in the
6
house.
of the 8 tests, and the last 2 tests he didn't finish, and that's the only reason why they were scored in the way in which they were,
And why didn't he finish?
because he was tired. 6 hours.
Now he gets impulsive and frustrated.
So what specific tests revealed that Mr. Wilson was impaired in the executive functioning and delayed memory when you conducted your tests, sir?
It was a much shorter part. It was trails, copying a square and drawing a clock. That was executive function.
Good morning, Buttons. Good morning.
So are you familiar with the Dallas Kaplan phonetic verbal fluency test, sir?
Bryn Emerald showing off
That's
with her
decounting
great
the
tea and
words.
honey. Show off.
Or did the word come up with words?
Yes.
Like what that was done on the MoCA?
His face
No,
looks
they were
like he
done
by-
fell asleep on
they
the
were done by
spiral
Dr.
notebook.
Eisenstein.
We're gonna keep that one.
Verbal fluency
'cause
is a
that's funny.
neuropsychological test. I don't do neuropsychological tests. I'm a neurologist. I'm limited to something like a MoCA.
But you've heard of the Dallas Kaplan executive function system,
I
is that
have.
right, sir? Okay. And would you agree with me, sir, that that's more of a comprehensive measure of executive function than the MoCA?
Word finding is going to be left frontal, posterior broca, and not necessarily indicative of executive function. It's more indicative of language.
With evaporated milk.
Well, let me
Hmm.
ask you this. Did you see any of the neuropsychological testing that?
Okay, Leslie, be good.
Wilson
Have a good
underwent
day.
That was performed by Dr.
Hey,
Eisenstein?
SD. The Beatles. I love the Beatles. They're my favorite. Urge to get going. Scrub something out of the graffiti face. Hey.
I had some morale at work and didn't make heads or tails of it. Oh, hang on.
You know, he shouldn't be put down
Thank you.
like a beloved pet.
Composite score
He
summary.
should be put down, but
on
not
the
the same
ways
way I would
for
put down my beloved pet. Guys, I'm
verbal
listening. I'm gonna get
comprehension,
me some more
average,
coffee.
verbal,
So you
reasoning,
guys
borderline,
hang,
working
hang.
memory, average,
We got
processing
this.
speed, average.
I got to
full
make sure I
scale,
don't roll over any
average,
pets'
general
feet
ability, low average.
while I get up.
So wouldn't you agree with me, sir, that the neuropsychological testing that Mr. Wilson underwent by Dr. Eisenstein would be of help in addressing your opinion with regards to executive function?
One limitation of neuropsychological testing is that it doesn't properly estimate premorbid function. If you look at Mr. Wilson's grades back in grade school, he had A's, mostly A's, B's, and C's.
Milo,
What happened? Point is, you can have a significant decline as a high functioning individual and do well on neuropsych testing. That's limitation of neuropsych testing. It's one of the limitations I have with people coming in, I evaluate for dementia. If they were doctors or scientists, they sent to neuropsychologists, they come across as normal, but they lost 30, 40% of their cognition already. They're dementing, but neuropsych testing was normal. So neuropsych testing has to be taken with a grain of salt.
What testing has to be done with a grain of salt?
Or you're telling us that, no, the neuropsychological testing that Mr. Wilson underwent with Dr. Eisenstein was not helpful to you. Is that what you're telling us here today?
Well, as I did not have it, it was not helpful.
Okay.
I think they retired old Smokey.
So you'd also agree with me that
I
there's
think it's
actually no
lethal
evidence of
injection now.
executive function, brain damage,
Bad girl.
the life
Bad girls,
functioning,
bad
or the
girls.
events surrounding these particular murders back in October of 2000.
Alicia Renee says, get on with it. They're not going to sentence him until 2 o'clock.
I wouldn't say there's no evidence. And the crime itself, I think, indicates that he has some type of impairment.
Really? And what might that be?
How about he's just fucking evil, man?
To strangle a woman? Did he plan to do it? Or was it an impulsive action and an overreaction?
Well, we're going to get to that in a minute. I want to talk to you a little bit about the head trauma. You indicated that you had an opportunity to talk to Mr. Wilson as it relates to the head trauma that he sustained growing up. Is that right?
He makes
And
me
you based
so
your
sick.
decision on, or your determination on
And the
the
fact
couple
that there are
accidents
people that
you-
support this guy just,
I took all those with a grain of salt and added to his physical.
he's got a
exam
lot of
findings.
salt, this guy.
The abnormal reflexes he had suggested that he had some type of pathology, either in his neck or his brain. But people who have neck injuries frequently have brain injury, or vice versa. They have brain injury, they have neck injury too. So I don't know if his hyperreflexivity was from his brain or his neck. but I'm here to evaluate for traumatic, evidence of traumatic brain injury.
Well, Mr. Wilson, when he's talking.
They're trying to
you
spare him
about
the death
his
penalty by
car
saying he's got
accidents,
brain
never
damage, and
gave
that's
you
why
any
he acted
dates,
the way he
times,
did.
Specific locations as to when these occurred. Isn't that fair?
And I'm saying that's
Location was
bullshit.
Tallahassee area, but in times, no.
You don't even know
He's just
when that occurred,
EVIL.
right?
I do not know.
You don't even know if that occurred. Is that fair?
As I have no medical records, as he didn't go to the doctor, I don't know.
Correct. So you're relying solely upon what Mr. Wilson is telling you. Isn't that correct?
I'm taking it with a grain of salt. If his neuro exam was completely normal,
It's
I would have a
assault.
hard time believing it, but it wasn't normal, so I had to believe him.
Well, you also indicated that you had reviewed something involving his sister, Dr. Wendy, who happens to be a radiologist. Were you aware of that?
I knew she was a doctor, but I didn't know she was a radiologist.
That's what they are. They're
Would it surprise you,
Mansons.
sir, that
Manson's Moonies.
when Mr. Wilson actually had an accident, that he went to the hospital, that he had CT scans that were done?
Wilson's willowy women.
In 23.
How about
or when?
Wilson's weak
When he had his
willowy
accident?
women?
I didn't know that. I didn't have a CAT scan.
Well, would it surprise you to
$400 an
learn
hour,
that
Amanda,
his
he's
sister
paid.
also had gone and reviewed those particular CAT scans and found them to be normal?
I agree, Jay.
A CAT scan being normal simply means that there's no evidence of acute trauma. There's no evidence of blood. There's no evidence of subarachnoid hemorrhage,
Morning
epidural
cherry
hemorrhage,
flavored and
intraparenchymal
acids.
hemorrhage, or anything that a surgeon has to
Wilson's
deal with.
wacko women. There you go.
So when Mr. Wilson was telling you about all these various injuries that he sustained to his head, did you do any follow-up to corroborate any of the information that he had provided to you?
live stream. Are you okay?
As I was aware that there were no medical records, I did not look for no
Are
medical
you feeling
records.
better though? Are you feeling better?
Well, did you bother to ask him for any further specific details as it relate to the accident? Whether it be on the beach or in the Tallahassee
Oh my
area?
God.
I did not, because there was no medical records to support it, and there's really no point in getting more details about it. There's no medical records.
You also told us he had a couple sports injuries whereby somehow he had gone ahead and bumped his head and lost consciousness, once during a football game and once during a baseball, but he didn't tell you when those occurred. Isn't that correct?
He did not know. I assumed during high school.
You're assuming a lot of things in this particular case, are you not, Doctor?
Objection argumented.
Sustained.
Yeah. Wow.
And Doctor, you indicated that you had an opportunity to review a series of scans
Right.
in this particular case. One happened in April of 2023, and the other happened where you had an opportunity to review an MRI scan of August of 2024. Is that correct?
Exactly. That is
This is
very
correct.
strange.
And you also had the opportunity to review the records
That's really
that were
crazy. Yeah, I
contained
didn't know you were
as
sick like
related to
that.
those scans in April of 2023. Isn't that correct?
I looked at my records. I do not have that scan. I do not have it. So,
You're gonna have to let me know what
but
it
I've been
is.
told it's
Can
normal.
I call you? Can I call you back?
Matter of fact, the impression was there was no
Okay,
acute
I will
intracranial
do.
abnormality.
Okay, I love you. All right, bye.
Again, it was a CAT scan,
Sorry about that,
which looks
guys.
for acute
My friend
blood.
apparently was
That's what CAT scans
pretty
are for
sick
in
there.
trauma. Looking for blood, looking for epidural
Delirious,
hematoma,
talking about possum tail
uh,
tea, my
subarachnoid
friend.
hemorrhage,
No shit, serious.
intraparenchymal hemorrhage, any kind of blood anywhere.
Delirious,
You'd
talking
agree
about
with me,
possum
sir,
tail
that a
tea. They don't drink
non-contrast
possum
head
tail
CT
tea.
remains the imaging of choice when you're for patients that are presenting with an acute TBI. Isn't that correct? Or traumatic brain injury.
Yes, because that's the test that determines if we had to do anything
Infamy
at
is
that
the
point in
new
time.
famous,
It's
right?
not meant to be the total
Gypsy Rose
evaluator.
brought that in, everybody.
But in
That
this
was
particular case,
thought
at that
there'd be no
particular time,
damage to
there was
that.
no acute intracranial abnormality that was found.
One of my
with the
best
CT
friends
scan,
called and
correct?
she was sick for the past
Correct.
couple
That was
days.
done by a radiologist.
She was delirious and she was
It
telling
was done by a radiologist.
the
taking all
doctor
holes, but it
that
was read by
her
a
wife
radiologist.
makes her
The,
possum tail
CAT scan
tea.
being normal does not say he did not have a concussion.
She
If I had to
doesn't.
count the number of people who had concussions in normal CAT scans that I've seen, you wouldn't have enough things to count with.
Well, doctor, you'd agree with me that radiologists are trained to read and interpret medical images, correct?
They
Peggy
are.
X.
And it's their specialty to diagnose and treat conditions using imaging equipment, right?
Yes,
Matter of fact, they perform all the radiology modalities, which include x-rays, ultrasounds, nuclear medicine, MRIs, CT scans, PET scans, and the such, correct?
yes.
They all have, and you'd agree with me, all those modalities have different properties. And they
This
produce
doctor isn't
different
holding
images
up
in
very
different
well, is he?
anatomic planes, correct?
That sounds reasonable.
And you'd also agree with me that radiologists also review thousands of images in a typical week.
Depends on the radiologist.
And you'd also agree with me that they know how to combine findings of multiple different.
I agree,
studies to render a
grateful.
diagnosis,
Grateful Grandma, I
correct?
agree.
Most do, yes.
And in
And he
this
knows what
particular
he's doing
case, sir,
now,
isn't it in
too.
fact true that when you had respectfully requested that Mr. Wilson undergo radiological assessment, that one of your requests
agree.
was that you did not want the radiologist to interpret any study unless mandated by the institution, isn't that correct?
That's correct.
And why is that, sir?
Because radiologists make mistakes, and a mistake such as reading something normal when it's not normal is very hard to undo.
Matter of fact, isn't it in fact true, sir, that you look at it for
Yeah, right?
the
That
language correct?
hand signal.
A radiologist does not look at it from a criminal perspective.
Jolie Johnson's got a
Yes,
song
for example,
here.
the ventricular symmetry. Ventricular symmetry is a normal finding, but in the setting of psychiatric disease, it means something else. The doctor reading it had the information that he had a psychiatric disease. And that's just an example.
All right, so a radiologist would be looking at it from an objective point of view, and when he found that there was no
I agree, Buttons.
intracranial abnormality, he would be wrong?
He's not doing good.
The ventricles are symmetrical. If they said they're normal ventricles, that's wrong. They were asymmetrical. So that would be a misdiagnosis by the radiologist.
Well, let's talk about that. You had some MRI scans that you had the opportunity to review.
You know, he
taken
just
on
is
August 21st
sitting
of 2020,
so
correct?
disrespectfully. I'm sitting more respectfully in my
fact,
home than
the
this guy
MRI
is sitting in
scans
front of
Also.
a
revealed
judge. I mean,
that
he's all Aishka Sprout. Like, you don't sit like
there
that.
was
Close your
a
legs, sit up
unremarkable
straight,
conventional brain
and act like
MRI
you're on
examining the
a
left
trial for your
contrast.
fucking life,
Do you
asshole.
agree with that assessment, sir?
Pardon my language,
From
guys.
from a perspective of
You can take it
major
with a
disease,
grain of salt,
stroke,
as the doctor would
MS,
say.
anything you look at, yeah, it looks normal.
Matter of fact, the findings in the MRI scans were that the ventricles
The
were
woman
normal
next
in
to
size
Wade,
and position
his
without
lawyer's a
evidence
female, I believe.
for hydrocephalus.
There is no hydrocephalus. In fact, the ventricles are relatively small, indicating that he may have increased intracranial pressure.
And then we also find that the fourth ventricle is midline and no shift is noted.
Hey, teacher,
right?
have a great day,
Yeah,
all right?
it's brainstem. That's fine.
When you're at home tonight
It also
sleeping,
says
I'll
that
be at
no,
work.
it alludes that neuroquant was not done. No computerized
Go to John, he's
evaluation
in
of the
prison.
MRI was
He has
performed.
brain issues,
It
yep.
was, it's not out of order.
In order to do a neuroquant,
Yep.
wouldn't you agree with me that that's just a computer analysis to quantify those matters, isn't that right?
It is, and also to put validity in what I'm
Sound
saying
like
versus
an
the
evil
radiologist is saying.
doctor,
Who's right? Who's wrong?
Wade does on the
Well,
phone,
If
right?
there's really nothing to quantify,
Yeah, I have a
Why
Facebook
do
page,
neuroquants
Toddy One
available?
Skip. I just,
The ventricles are
all it is a
asymmetrical.
page, guys. I
that would
really
show up on
don't have
neuroquant.
anything on it. I'm a one-woman show here. I'm trying
His
to
anterior
do
temporal lobes are
Instagram,
atrophy compared to the rest of
TikTok,
his left parietal
Facebook.
lobe.
and YouTube and work and take care of these
So
puppies.
doctor, when we're talking about the MRI scan and the CT scans, both of the radiologists that had gone ahead and reviewed both of those particular records found them.
SD,
But you're telling
I
us here
believe
today
so.
that
I'm not
you
a
found
doctor.
Abnormalities.
I believe so.
Abnormal as it regards to behavior. When you have asymmetrical ventricles and you have some
Oh,
relative
thanks,
atrophy
YouTube
from the
Streets.
rest of the
Yeah,
brain.
guys, smash
These
that
are
like
not
button,
gross
please.
abnormalities.
All right, let's talk about his behavior a little bit.
Thank you, Mundu the Pixie.
Do you have any independent corroboration besides what Mr. Wilson told you on that?
Catherine, have a good day. Yeah.
day when you did the assessment?
At 2:00, they're supposed to do the
reviewed some of
sentencing.
Records in this particular case with regards to.
Look at those jelly
homicide
shoes.
That took place on
Shower
the 7th of
shoes.
October of 2019.
The homicide itself, I was looking through my records and I have no documentation of the action of the murders. All I
Hey,
saw
Lori.
was I was able to see online. And I don't know if that's correct or not, so I can't testify to it.
That's sad. SD, that's sad.
So you have
Thank you guys
absolutely
for hitting the like button. Thank you so much, guys. Thank you, YouTube
no
Streets. I
idea
always
as
forget.
to
I do. I
how
always forget.
Mr. Wilson was acting and or reacting and or interacting on the 7th of October of 2019.
Totally agree with you.
All I can say is that based on what I found, he's more likely to be
It could
easily
definitely be
agitated
drug use.
with difficulty controlling that agitation and acting upon that agitation with regard to consequence.
Yes,
were
I do
telling
want to
us
sentence.
earlier,
I do want to live stream it
what
too
were-
for the
what were the types
sentencing.
of-
Yes.
Items that you had to review in this particular case.
Thank you for pushing that thumbs up.
The juvenile
he-
justice
The
patient.
doctor's not
all
looking
the things He
good.
did all the burglaries.
He doesn't have any confidence, right?
And a boatload of jail medical records from 17, 18, 19. A letter from his sister.
It's 10:17 a.m. on Eastern Standard Time.
And that's about it.
That's it.
I just have a
I
bunch
agree,
of,
Julie.
I have hundreds and hundreds of jail records. And I could not find
And I
any
agree
kind
with you,
of,
not
hospital
sorry,
records in my
Charlie.
jail records, so I don't know what you're finding.
Boatload of BS. Yep.
Well, would you agree with me, sir, that when you are in the process of diagnosing someone, that it's also important to make sure that you have some support for that particular diagnosis?
It would be great if I had something. Most of these these convicts don't go to the hospital. They have hit their heads. They don't go anywhere. They run from the law. They're always in trouble, and they refuse medical care. So consequently, I have no medical records.
You'd also agree with me that a lot of
All
these
of them. He
individuals
said
aren't
all of them.
forthcoming when they relay history to you as it relates to them. Isn't that correct, sir?
This is true.
Hi,
They have secondary
Alexandra.
gain.
Thanks, Julie.
So wouldn't you agree with me that it's important to see how a
Tucky.
person functions in his everyday life, to have a kind of a baseline?
Gleaned a bit of his behavior, judging from how many times he was in juvenile detention and his complaints while in juvenile detention, all the depression, the anxiety, and all before he was in jail for this. He's been battling mental health disease
That's funny.
for a long time.
Pin a rose on your nose. I love that. Thank you.
Also engaged in drug use over that period of time as well.
Yes, I am.
So whether or not a lot of these things are attributable to drugs versus a physiological aspect, you'd agree that's hard to discern. Isn't that not true?
It is, but why do people use drugs? To escape their mind.
Let me ask you this, doctor. What efforts did you undertake to ensure that Mr. Wilson was telling you the truth?
There's literally nothing I could do. The only way I can tell if they're telling me the truth, if I have medical record support of what they're telling me. He told me that he was on medication, that I can verify. So with some of the medications he was on, that I can verify. But as far as the head injuries, nothing's documented about those. So I have no idea if that's true or not. I suspect it's true because his brain supports it, but I don't have any records to corroborate it.
Well, did you have the opportunity to review a statement that was given to law enforcement by a gentleman by the name of Joshua Lukic.
I don't know,
Does not ring a
Babs.
bell.
Well, Joshua Lukic is an individual.
But he did
who called
admit to it. You
911
know that, right?
Regarding Mr. Wilson telling him that he had just killed two.
Wilson's
individuals.
weirdo, wacky
You
woman.
didn't have the opportunity to review that.
I like
statement,
that.
Did you?
I did not have that statement, no.
Matter of fact, you didn't have the opportunity then to listen to that 911 call, did you?
I have not.
Did you review of the statement by Miss Stephanie Johnson, who was with Mr. Wilson throughout the course of the evening and the morning?
I will do my best to remember the update. I'll be here at 2 p.m. doing this
I have not
live
seen any
stream.
statements.
So you don't know what, if any, effects or symptoms Mr. Wilson was undergoing back in October of 2019 when he committed these murders. Isn't that fact true, sir?
The all I'm testifying to is that his brain is such that he's more likely to be impulsive without recourse to consequences, easily agitated, and easily this fits within the realm of possibility.
Yo, I just want to say anybody
Well,
driving in
well,
South
possibly,
Florida
does it not?
has those categories, those symptoms.
Overruled at this point.
It's true.
Um,
No brain
what
scan
are you
needed
talking about?
to tell you that.
Well, you're assigning his actions to one particular.
Well, it's going to be multifactorial. Yeah, this is just one aspect to his behavior. He's going to have drug use. He's going to have whatever is going through his head at the time.
He did say boatload.
This
He
is
said
just
it a
one
few
aspect
times.
that makes him more likely to do something awful than not.
Oh, buttons. I'm sorry you got to go to the
Did
dentist. I
he
hate
have a
that.
relationship with an individual back in October of
Dentist.
2019?
It doesn't stop him doing that, but it likely makes him more likely to be tumultuous.
How do you know?
I'm just saying, from his abnormalities, this is behavior that I would expect. I don't know it.
Small
I expect
fry.
it.
Welcome.
Well, did you have an opportunity to corroborate any of that information? Did you have an opportunity to speak with a young lady by the name of Miss Melissa Montanez?
I don't know who that is, so no. But I had an opportunity to see him overreact and do things that he didn't want to do. Just when
That's
I was
right,
in Boca.
YouTube streets, because you're a
I
good
saw his
guy.
behavior right there.
Well, is in fact true, sir, that you didn't have an opportunity to see how he was acting back in October of 2019?
I met him last week. How am I supposed to know what he did in 2019?
Well, aren't you here to explain his actions back on the 7th of October of 2019?
Didn't look good on you, Doc.
Based on his neurological abnormalities.
He's getting defensive. The doctor's getting
Only.
defensive. It's not a good look. It
You don't
doesn't
know
help
what his
Wade.
ability was
So that
and
works
what
in
he
our
was going- what was
favor.
going
Our
through his head when he
favor.
went to a music venue that night. did
Wade
you?
Wilson's Army. You
As
got a
ventricular
bad
asymmetry
doctor.
is typically congenital, and atrophy takes time to develop. I would position that these findings are likely predating 2019, probably sometime after he was a teenager.
Well, if they're
Or as a teenager.
predating 2019, you would expect some kind of symptoms to be present at that point in time.
They're
would you
eating
not?
this doctor up, man.
Impulsiveness, agitation. How do I know it's not there? I would say that it's likely that he had those things then.
Really? Well, you didn't bother to go ahead and speak to Mr. Lukic or Miss Stephanie Johnson, who had contact.
I
with
agree.
him.
I think
You
his
didn't
dad
have
is a
contact
hero.
with Miss Melissa
I think
Montanez,
Wade
who tell you a
Wilson's
little bit more
bio
about
dad is
her
a hero.
contact with Mr.
I agree
Wilson.
with you.
Did you, sir?
I did not know them. How am I supposed to contact them?
Well, you had the case report, did you not, sir?
I did not have the case report, no.
You didn't have the case report as it applied.
I did
to
not
Mr.
have any of that,
Wilson.
nope.
So you guys do know, I mean, I don't need to tell you this, I'm pretty sure, but those that don't know, he is shackled. His wrists are
Sir, do you
shackled
remember giving a
to his
deposition
waist.
Yesterday?
and his legs,
No, I
his
don't remember that.
ankles
Yeah, I
are
remember it
shackled.
yesterday.
All right. Matter of fact, one of the questions I had specifically asked you was whether or not, and I wanted to make sure that I understood you correctly, was that you said you had a criminal justice face sheet, you said you had a case report, you said you had a series of medical records, you had a letter from Mr. Wilson, and then you had a school records. And I asked you if that was accurate.
I had a face sheet, but it was Department of Juvenile Justice face sheet.
I also asked you, sir, whether or not you had a case report. You told me that it was accurate.
I must have misspoke because I do not have that.
So you misspoke twice?
Objection argumentative.
Let's get those grains of salt, put it on the bad boy, and cut them up and
Um,
eat them, because that's what's happening here.
It's a record.
They're
I have
chewing you up, doctor. Chewing you up,
a
buddy.
bunch of
They want their $400 back.
records that are all that look like jail medical records that are all a couple hundred pages each of just mundane information.
So I didn't read them.
So, yes, I misspoke twice.
So getting back to October 7th of 2019. did you have
Wade's
an
sitting there going,
opportunity to speak to
$90,000. This is the
two
best you
ladies
could
by
do
the
for
name of
me.
Shana Williamson, Don
Damn.
Griffin, and Amy Slobogian about
I-
what they saw.
Grateful
I did not
Graham.
I do not know who they are. I didn't know they were involved. And I did not talk to them, no.
Did you have an opportunity to review a statement of an officer by the name of Timothy McCormick, which depicted his
No, I did
contact
not.
with Mr. Wilson?
I did not talk to anybody. So I
This
was gonna
guy
be
did not
surprised.
do anything for $400.
Well, did you have an opportunity to watch the video of the interaction between the officer and Mr. Wilson?
There's a video? No, I did not. I don't have that video.
Did you have an opportunity to watch the video of the interaction that Mr. Wilson had with the audio?
For $400, this guy just
interaction that
lost
Mr.
his
Wilson had with
reputation. You know
Detective
that,
Nick
right?
Jones?
No.
Did you have an
$400. He just
opportunity
lost
to
his
listen to any of the
reputation.
jail calls that Mr. Wilson had made to a number of individuals.
No.
Have you had an opportunity to review any of the emails, numerous emails that Mr. Wilson has gone ahead and sent out?
Didn't have them, so no.
So if he was able to recount
Julie,
details
you're
of the
right.
murder and those details were backed up with evidence, you'd agree with me that his executive functioning or his ability to
That
remember
doctor
his
wants to
items
leave.
and what you have gone ahead and learned as a result of your assessment of Mr. Wilson may not necessarily be accurate.
Long-term memory and memory events that are very impactful tend to stick better than shoe, red, velvet.
He's not bothered at all.
Well, when Mr. Wilson goes.
But
ahead
he's
and
going to
kills
be,
Miss
because this is
Melton
ruining his
early in the
reputation. You know what
morning,
I'm saying?
proceeds to attack Miss Montanez shortly thereafter, and then goes ahead and kills Ms. Diane Ruiz within a matter of 6 hours, and then goes ahead and reports that to Mr. Joshua Lukich. You'd agree with me, that's relatively short-term memory, would you not?
Those are major events. People tend to remember. Those are harder to. I mean,
Forget?
he's not demented. I mean, he just has some short-term memory loss. He has impairments. He's not totally.
He remembers to
out to
ask for the
lunch.
kiosk. Come on.
So, doctor, if he's not exactly out to lunch, then is it fair to say, sir, that Mr. Wilson can function in a normal society without a lot of those symptoms and things
What?
that you were talking about earlier?
Huh?
I'm not saying he's incompetent. He has impairments that makes him more likely to be impulsive, easily agitated, and do things without consequence.
He's a teenager. That's a teenager, man.
And you said that he couldn't think these things through?
Not in the moment.
That's a
And
teenager.
In addition, because of amygdala atrophy, he's less likely to be able to calm himself down in a reasonable time.
How long would it take for him to calm himself down, sir?
It depends on what's keeping it going.
Well, if he had atrophy, that indicates that he would have some kind of loss of brain mass, correct?
he has reduction in brain mass. It's not gone, it's reduced.
Well, if you have loss of brain mass, wouldn't you also have
Reduction.
ventricles that would increase in size?
Not when
I
it's on the
agree,
outside
bad
of the
girl.
brain, such as the amygdala. His lateral horn is actually relatively large considering the rest of his ventricles. So the lateral horn of the temporal tip is a little wide considering the level of ventricular size elsewhere. So, yes.
Lori, this
Let me ask you
doctor,
this last question,
he-
Doctor. Would you agree with me, sir, that
he's not
you're
doing good.
attempting to correlate brain changes that you observed in Mr. Wilson to predict?
That other guy needs a microphone. The lawyer.
That would be my limitation, yes.
So what you're telling us here today is that you would have been able to predict that Mr. Wilson would have gone ahead and committed those murders back in October of 2019 of Miss Melton and Miss Ruiz based upon his changes in his brain. Is that what you're telling us here today?
No, only that he would be more likely to than the average individual.
I have no further questions.
Hi, Gracie.
Now, you had a chance among the materials that you reviewed was a CAT scan.
That's
from
his lawyer, the blonde
2023.
woman.
Is that correct?
I have the actual CAT scan.
Okay. And that CAT scan was administered because Mr. Wilson had head trauma in 2023.
Yes,
So he had head trauma that he didn't even report to you on top of the other head trauma that he did report to you.
correct.
Now, just for clarification, CAT scan normally done at the hospital, like right after an accident.
Yes.
That's good, Gracie.
They don't
Fuck,
always
that's
do an
wonderful.
MRI.
Thank you.
No, MRIs are more expensive. They take longer, and you need something in the emergency room to be very quick. CAT scans are quick, and they tell you what you need to know. They tell you whether there's a hemorrhage, again, skull fracture, epidural hematoma, subdural hematoma, subarachnoid hemorrhage.
Something
Those are
that
things
you
you're
want-
looking for.
Something that you want to know so that you could act in an exigent circumstance in order to
Thank you, Ducky.
stop that.
Right. If he needs to be referred to neurosurgery and have a hole put
Minus
into
the
his
3
head to
times.
drain a subdural hematoma, then he needs to have that done. But there's no bleeding, then there's really nothing to get overly concerned about. Because if there's like interparenchymal hemorrhage, then they'd be admitted for watching for swelling, and they need to have a flap put in their skull. Yeah, that,
But if he has brain trauma, that wouldn't necessitate a CAT scan, would it?
brain trauma.
Yes.
Well, typically you do a CAT scan if there's head injury because you gotta make sure that you don't.
He has a
no
team of
bleed.
like
If you miss a
5
bleed,
lawyers,
you're
Julie.
gonna get
This
sued.
guy
All
is
right, but do you have to
doctor,
have a bleed
supposedly.
every time you have brain trauma?
No,
He likes
most
a
of the
lot
time
of
you don't.
salt, apparently.
Okay.
Because he takes things with a grain of it. That's what he says.
So a CAT scan wouldn't help you.
There's
if you're trying
Prince
to do dialysis
Charming.
That you were trying to perform with Mr. Wilson.
Remember, guys, all
Only
those
if it's
tattoos on
grossly
his face
abnormal.
were done while he was incarcerated. Does not follow the rules. You're not allowed to write on yourself in prison or jail.
The test results from Dr. Eisenstein, you had an opportunity to review those?
The test sheets,
Yes.
yes, I couldn't make heads or tail of them.
Okay. But nothing in
Thanks,
there
Mundu.
stood out as being inconsistent with your diagnosis here today.
No, because I couldn't make heads or tail of them.
Okay. But I mean, he's in there reviewing, he's a neuropsychologist. Just because it says neuro, he's not testing for the same thing that you are. Is that correct?
That's correct. Neuropsychologist is different than neurology.
All right. So as a result of his testing, his testimony, that of the psychiatrist, Dr. Mills, they're more focusing on things like the bipolar and it's not schizophrenia. What was
Schizoaffective disorder.
schizoaffective disorder? They're focusing more on those types of things.
Oh my gosh, that's horrible.
And you're looking at long-term
Sorry to hear that, Gracie.
brain injury, for lack of a better term.
I'm looking at neurological consequences of trauma and development.
Okay.
And ventricular asymmetry is important because he has psychiatric disease.
You mentioned the term atrophy a few times. Would you contemplate that there would be additional atrophy in the future?
I would, this is
He's a moron.
speculating, so I don't know, but as he ages and there's general atrophy, he'll have more atrophy in his frontal lobe and his temporal lobes.
Yep, Peggy, he did.
But you said medication may help.
He might want to
Medication
run
could
him
adjust
over,
behavior.
Adrian. He might want to run him over 100
modifying
times.
some of the impulsiveness, the agitation.
Absolutely,
gonna
I'm
regenerate
definitely going to
brain
keep her
tissue.
memory
Not going to
alive.
bring it back, but it could be treated.
Absolutely so.
Were you aware that he had consumed drugs
Happy
that
birthday,
evening
doggy.
before he committed any of the homicides?
I was aware of drugs, yes.
Do you know what type of drugs?
No, because I was aware because I read it online somewhere.
Okay. Would controlled substances, depending on what it was, aggravate the anticipated conduct of Mr. Wilson?
It all depends on what it is. I mean, marijuana would tend to calm someone down. Methamphetamine would make him much more agitated, and any kind of the stimulants would make him more easily act without thinking.
So there are controlled substances out there, depending on what he took, that could have made him a lot worse that evening.
Yes.
They don't even have to be controlled.
Now, the fact that Mr. Wilson killed a woman with his bare hands at some point in time during their conduct with each other.
Two women.
A couple of hours later, he goes out and he savagely attacks his girlfriend. And then a couple of hours after that, he goes out and kills another woman. Is that the type of conduct that you would expect and anticipate?
You'd
from
think so,
somebody
Rebecca, but that's
with
his look.
brain injuries.
His brain injuries, his psychiatric disease, as well as the drugs he's on, likely resulted in this awful behavior.
Miniature
I don't
poodle.
have any further questions.
Very cool.
Anything else?
No, Your Honor, thank you.
All right, you may step down.
Are you impressed with him, Wade Wilson? Stop licking your lips.
Okay, well, do you have any other witnesses?
No.
Okay. You do? Okay, yes, all right. We'll take a 10-minute recess, come back then at
10 minutes,
a little bit
guys.
more than 10
I'm going to
minutes, come
leave
back at
this
10
going,
minutes,
but I'm going to go to the bathroom. I'm going to make some more coffee,
11.
might make something to eat,
10.
and then I'll be back in 10 minutes. All right, guys? Those that can make it will make it. Those that can't, no hard feelings. Those that can't be in front of the computer, you could listen to this. You don't have to watch if you don't want to, or we can all just hang out. Coffee break. Bye, buttons. Where's my son? There's my son, Milo. Milo. Danny. Hey, Bubbaloo. Who's that? So she, they're my girl. My girl, my girl. Talking about my girl, my girl. Danny, you're a banana. I love you, girl. I love you, Danny. What do you want? Precious and few out of the numbers. Share, Danny. Danny, you're a banana. Ay, 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 ay. We're gonna get back. All right, all right, all right, all right, all right. Hey, precious, a few are the moments we two can share. White and blue like the sky. And if I can't find my way back home, it just wouldn't get better. It's precious if you are the moments we two can share. Woo! Danny, you're a banana. Milo and I love you more than anybody else. Daniela, willa. Whoa! Milo, take the garbage out, little boy. All right, all right. Let me shut that. I did mute myself because I tried to call my friend back and I just didn't want her business going all over the computer. You know, the possum tail tea that she was thinking about. Will they do victim? I would think that they would do the victim, the impact statements. I would think so. I'm not 100% sure, but I would think so. Ruth Carroll, water your plants for me too. I'm really bad at that. I don't have any plants. I have dogs. I water them. I would think that they would do the victims, the impact statement. Yes, I would think so. And again, I really think that he's going to be grandfathered in to the penalties at the time. And the penalties at the time, it wasn't the death penalty, unfortunately. But I also did hear his dad did an interview, and I think his dad said that his son said he would rather not be here than do every single day in prison for the rest of his life. I would think that if Wade says something, I would believe the opposite. So if he says he wants life in prison, I think that he wants death. And if he says he wants death, I think he wants life. So I think he's a liar and he's going to get whatever he gets. And here's what else is going to happen. So you heard him say he wants the death penalty. So he wants to live. That's my opinion because he's a liar. I just want him to be miserable. I want him to be miserable. End of story. I don't care. I want him to be miserable. That's all right. He's going to have a harder time this time because the dumbass got a bunch of tattoos that I think offends every frigging group in there. Like he wasn't even smart in the way he got his tattoos. I think he's got a tattoo that offends every single gang in there. And listen, Gracie, when I say let him rot, I mean let him sit in a cell and leave him there. Just leave him there. The homeowners listening? The homeowners listening? Are they okay with me talking? Are you going to get in troubles? Carms. DP will let him off easy. You think so? Thank you guys. So a few of you, did you guys see me in the chat last night with Morbid, Sir Morbid, and some other people and Nina? Did you guys happen to catch that? Because I woke up to a bunch of stuff saying, look out for Katie Joy. She's coming at you, Toddy. Toddy, she's coming at you. You see the smile on my face? Ask me why I'm smiling. Oh, guys, I am going to take this. This is my friend that really is sick. And then I'll tell you, I'm going to put this on, yeah.
right, let the record reflect that the state's present defense
Hey guys,
counsel,
I'm
the
back.
defendant are
Sorry
all
about
present,
that.
ready to
Sorry
proceed.
about that. I got a friend that's suffering with pancreatitis.
All right,
The state calls Dr. Thomas Coyne.
okay, and I just make sure from the defense, there were no other witnesses from the defense.
There's
Sit
no other
down,
witnesses. I
Wade.
just have something to read into the record.
Okay,
Would you rather me do that now?
yes, I think this is your portion, and
It is.
does your client wish to address anything in this hearing?
I don't think so.
Okay, all right.
Mr. Wilson nodded his head no. Judge, this is a letter from the adoptive parents of Mr. Wilson.
Listen up, guys.
It's been 5 years since the worst of this began. You can't possibly understand how sorry we are for the families affected by this tragedy. We cannot change the past, but we wish we could. On that fateful day 5 years ago, not only were the lives and the dreams of 2 women lost, with their families left behind in shock and grief, but another family was left shocked and grieved over a different kind of loss. It's easy to recognize the victims and their families and to feel profound sympathy for all they suffered and lost. But one group that isn't often recognized as those also suffering is the family of the accused. Our journey of loss didn't happen all in one day as theirs did, but it was heartbreaking nonetheless. Wade was a joyful child, loved his parents and sisters, and was loved immensely in return. But over the teen years, and then especially in the early years of adulthood, Wade began to slip away from us, becoming withdrawn, erratic, and depressed at first. Then as addiction was added to mental illness, he became frankly paranoid and delusional, and the sense of loss became increasingly sharp. He was in the system for years trying to get help for his mental anguish and for his addiction. They put a tiny Band-Aid on it and then sent him back into the world without a
See
diagnosis.
Sparks or see
medication,
Parks.
and
I'm not
without
trying to be
follow-up
funny,
care.
but if you love this guy,
We
I
tried
want
to
you
hold
to
the
tell
pieces
me
together,
why.
but had no idea
Tell
how
me
to
what it
find
is
the
about
support
him that
Wade
you love.
needed
I'm not trying.
to be the
Nobody
person
pick on
he was
anybody on
inside.
it. I want
The
to
system
know.
failed him in that fateful day in 2019. We lost the last piece of the son we loved and all the hopes for his future. In those tragic moments, when the cancer of severe mental illness and addiction won, we lost our son, grandson, brother, nephew, and uncle. So we understand the despair, anguish, loss, and hatred for someone or something that takes away someone you love. Because despite everything, Wade is still our son, and we love him. The hopes and dreams of his life are already lost, but the human is still in there somewhere, tortured beyond what most of us can even begin to imagine. Taking his life will not bring back those 2 beautiful women. There is no justice on earth for that kind of loss. Taking another life only adds to the tragedy. Please see it in your heart not to kill our son and make our innocent family suffer even more. The system designed to help those who suffer and are lost failed him. That system is broken and would be only further broken if it took Wade's last breath. That broken system owes Christine, and it owes Diane, and it owes their families, and it owes our family. It owes us all the peace that it did not provide to Wade. Candy and Steve Wilson.
So
We would
see
rest.
Parks.
Alright.
He
Notice
is all
passing was
those
filed for the
things.
defendant to ensure that he doesn't want
But
to speak
a
at this
leg
time.
Well,
that's
Mr. Wilson, you have an
90%
opportunity, just like during the other
cancerous
phases
might
of-
need
well,
to
let me
be
just finish real quick.
amputated because
Any
the
of
rest of the
other
body's
phases during
good.
the case, if you want to address.
I think
the
Wade
court,
is like
I would
that
permit you to
cancer.
Do that, obviously, everything's recorded, but you.
Look
would
at the
have that
look on his
opportunity if you
face.
Wish, no one can prevent you.
2
from
people brutally
addressing the court if
unalived.
you wish to, and no one.
Where is
can
the
make
remorse?
you address
Where is
court
the
if you
thing that
don't
he will
want
never
to.
do it
So it's a
again?
decision that's solely left up to you if you want to.
Look
address
at
the
him.
court or not.
Not today.
Thank you.
Later, when I come back, I will. Today,
Okay.
no, I won't.
Okay.
Okay, thank you.
His lip looks a little
State calls
fat.
Dr. Thomas Coyne.
All right, sir, raise your right hand. You swear affirm testimony you give will be the truth, the whole truth, and nothing but the truth.
I do.
You can take the stand.
Those are church-going people, just so you know. Those are church-going people that wrote about Wade. His family are
May I inquire,
church-going
Your Honor?
people.
May.
They don't believe in an
morning,
eye
sir.
for an eye.
Morning.
It's in the Bible,
Please
but
state
they
your
don't
name for the
believe in
record.
that.
Sure. Thomas Coyne, Coyne.
Dr. Coyne, did you testify in the guilt phase of this trial regarding the autopsies that you conducted?
I did, yes.
What is your educational background?
Sure, I completed my undergraduate degree at
Arrogant
Rutgers
resting
University,
face.
followed by medical school at Robert Wood Johnson Medical School, which is also at Rutgers University. At that same time, I completed a PhD in toxicology. After medical school, I completed a residency
You
in
do know
general
that he
pathology
lost
or
his teeth
anatomic
because he
pathology
got
at the
popped in the
hospital
mouth
at
last
University of
time he was in
Pennsylvania.
jail. You know that,
At that
right?
same time, I also completed a fellowship or
He had
subspecialty
beautiful
training
teeth.
in
You see the pictures of
neuropathology.
beautiful teeth, not so
And
much
last, I
anymore.
completed subspecialty training in forensic pathology at the Miami-Dade Medical Examiner Department. And so right now, I'm currently board certified in anatomic pathology, neuropathology, and forensic pathology.
Since we're here discussing the brain, specifically the defendant's brain in this case, would you describe what is neuropathology?
Specifically, it is the study of brain disease in all forms. And so we assess the brain from all
No, he
ages,
just has
from
half of his teeth.
fetal stages.
If you see
through,
him smile,
old
you'll
age.
see his missing teeth, and his
we
teeth are
look
all
for
cracked up.
both normal features as well as all different types of features of disease, ultimately to find out if there was any pathology that may explain why a person died.
Now, when you were a part of this neuropathology program, could you just explain what the practical part of that program entailed?
Sure.
Assess
There's several different practical components. One area is working directly with surgeons.
True that.
as well as
Denture's tattooed
neurologists in
on
the
his
hospital,
face.
in diagnosing disease in patients who are living. And so we would review a person's
The guy
most
has
often their biopsies
tens of thousands of
with a
followers, Aunt
comprehensive
Edna,
medical team
and over
looking at a person's
$90,000 was donated to
presentation,
him.
as well as their clinical findings, radiological
Good
findings,
morning,
and then
Sarah Lee.
add in our pathological findings. From a medical examiner perspective, we look at the actual brain in deceased persons. And so my job is to look at the brain to see if there is any underlying disease or injury that may explain why that person died.
How long have you
He's
worked
much
with
more
Dr.
clear
Coyne?
than the other doctor. He's
Since
got a lot more confidence, right?
2014.
And as part of your
lot more
duties as a
personable,
medical
you think?
examiner, do you
I think
conduct
he shows up
autopsies on a
better.
regular basis?
I do, yes.
Approximately how many autopsies have you conducted?
Close to 4,000 now.
Now, as part of your autopsies that you perform, are you equipped to examine the brain and determine whether the brain shows any signs of atrophy or any kind of injury?
Yes, specifically my neuropathology training allows me to do that.
And in every autopsy, do you examine the brain?
I do, yes. I examine both brains at
Yes, he
autopsy. And I
will.
also receive
Yes, he will,
brains
Ruth.
from
Somebody's going to cut
offices
it
and
right out
other,
of his face.
universities throughout the
Mark
country
my
to
word.
examine brain for disease.
And
Without
you
any
testified or have you
anesthesia.
testified as an expert specifically just for the brain?
Yes.
And can you just describe that?
I couldn't tell you exactly how many times. I've probably in my career testified over 50, but less than 100, and been deposed a number of times as well. In all instances, I'm generally called upon to testify as both a forensic pathologist as well as a neuropathologist, and at times as a toxicologist. But I have been called on probably greater than 25 times specifically just to testify as a neuropathologist.
Now, are you familiar with the field of radiology?
I am, yes.
Could you just explain what radiology is?
Sure. Radiology is very similar to pathology. We're called upon to identify disease or injury, assist other physicians in their management and diagnosis of that disease to further treatment.
He
But
did,
specifically
Sarah.
radiology, so me, I use my eyes, my hands. I
He was
use
trying to
also,
get into the group called
microscope
the
as my tools to
Unforgiven.
examine a
He
tissue.
failed.
Radiologists for most radiologists don't have that opportunity, so they use various machines which employ either a radiation or some form
His
of
tattoos
magnetism
are
to
insulting to
create
to
images
gangs.
of those organs.
Like
And do you
his
believe that the
tattoo
field of
is insulting to the
radiology,
Unforgiven, but then
someone
there's
who
another
examines
gang where one of
scans
his
that
other
important?
tattoos is insulting to
very
them. Like he
Is that a
excluded
field that
all the gangs
physicians
by
and
his friggin'
other
tattoos.
professionals rely upon?
He's
Yes.
going to get his ass
Now,
whipped.
when a radiologist looks at a film or looks at a scan, is it common for them to issue their opinion?
Yes.
Can you just explain how this process works when a scan is ordered?
Sure. So a physician would order a scan on a patient because they have a concern, obviously, based upon their clinical findings or the patient's presentation. So they would order a directed radiological image, depending upon what system they think is injured. So let's say, for instance, CAT scan of the head versus CAT scan of the chest. And then that radiologist would give their impression, or excuse me, their findings, which basically is just a description of what they're seeing on the imaging. And at the end of that, then they'll give their impression of what they feel is the underlying disease process that is responsible for those imaging findings.
And so, is it safe to say that these doctors and physicians rely greatly on those radiologists' impressions and findings?
Absolutely, yes.
Have you ever seen a situation where someone would order
Yeah, they are.
radiologists not to put their
They will,
impression or
Sarah.
finding on a scan?
Not
Sarah,
in my career, no.
Now,
They'll be eating them up like
one of the things that
desserts.
was brought up was CT scans, and they're essentially, I believe Dr. Rubino testified somewhat that they're fairly useless. Could you describe what a CT scan is and what your opinion is regarding CT scanning?
Sure. CAT scan is very similar to conventional radiography, but the machine takes multiple slices through a person's body, whether it's the torso, the head, the abdomen, the pelvis, or an extremity. And I think Dr. Rubino alluded to that it's the test we order in acute injury. So yes, it's very often ordered emergently because it's very good at picking up acute bleeding. So for instance, in the form of the brain, you can tell right away if a person has a skull
That's who he
fracture,
is,
if
Sarah.
there is a hemorrhage in one of the
Hi,
various
Cindy.
intracranial compartments, or if there is hemorrhage within the brain. But that's not to say that we can't get other information from that particular study. So we can examine brain structure. You can look at the relative growth structure of various brain regions. You can compare one side to the other. You can gain a good opinion as to what may be the underlying pathologic process that would then further direct other imaging. or
And
direct
no, that's
other
what they're
clinicians
trying to
treat.
show so that he
Now,
doesn't
if
get
you
the
saw a
death
T-
sentence.
CT scan that appeared normal with no issues, would it generally be?
This is the second doctor.
The new scans or other scans generally be ordered?
Well, in the setting of acute brain injury, you're going to use a CAT scan first and foremost to see, is there a neurosurgical issue here? Is there a bleeding in the skull itself, within the cranium, that would require surgical intervention? Is there anything emergent there? After that is
Yes.
ruled out, let's say, you're looking at the brain structure. If
It's all
you
right,
see
Sarah.
no abnormalities, no acute abnormalities. So for instance, let's say you have a mass lesion or a tumor in one part of the brain that can certainly shift the brain substance from one side to the other. That would clue in somebody that there's something else going on other than hemorrhage there that we have to attend to.
But not that other
But if you
doctor. He
see
didn't get that.
everything appears normal, it would not send that patient on to get further imaging. Because, you know, as physicians, we first do no harm, right? And anytime you order additional tests, it subjects that patient for possible harm or complications of that procedure.
Now, are you able to connect with what you see on a scan and predict behavior simply from looking at a scan?
No, there's
Yeah, I
a
don't know,
poor
but he's gonna get his
correlation,
ass handed to
between,
him, so it
looking at
doesn't matter.
changes in imaging. to
Jana
predict behavior.
Bradenhand from
Um,
South
And
Africa.
I think, you know,
Welcome.
Dr. Rubino
Welcome
talked a
to
little bit
this.
about that with regards to Alzheimer's
Grab some
earlier.
coffee, whatever
can
you're
speak to it
drinking
from a
over there. Don't know what
pathologist.
time of day it is in South
We certainly know
Africa.
that in patients
on,
with Alzheimer's
let's do
disease, they
this.
can have brain
He is
degeneration
evil.
with significant atrophy of the brain.
You're right, Ann
And
Edna.
you can see that atrophy on imaging. And then if that patient dies, I can look at that person's brain and see an enormous number of plaques throughout the brain. But the level of atrophy or the degree of plaques or plaque burden doesn't necessarily correlate with predicted behavior. So I can't say that a person with this amount of atrophy would have, a corresponding amount of cognitive decline, because there are a lot of individual differences. Each person has their own functional cognitive reserve. A lot of that's based on education, also based on genetics. So the long and the short is, it's very difficult to predict behavior from looking at a scan, or even me looking at the brain itself.
So you would disagree then when Dr. Rubino testified that he could determine the defendant's behavior simply based on the brain scan?
Yes.
Now, another thing that was mentioned was the fact that the defendant had these football injuries and some sports injuries. Are you familiar with CTE?
Very much so, yeah. As a matter of fact, neuropathologists are the only ones that can truly diagnose CTE.
And can you explain what is
Pizza
CTE?
Lunchable.
CTE, or
I got
chronic
pizza.
traumatic encephalopathy, is a type of neurodegenerative disease similar to Alzheimer's in the sense that the pathology is based upon the accumulation of
Pink, I don't
tangles known as,
understand that
tau
either,
or
Pink. I don't
hyperphosphorylated
understand
tau.
that.
The
I'm a
interesting thing
Coca-Cola
about
girl, no Pepsi here.
CTE or chronic traumatic encephalopathy is that what is necessary for the development of the disease is a history of either concussions or subconcussive injury to the brain.
Now, if you were to watch the news, it would appear that every football player who hits their head has CTE. What is
Yeah.
the reality of that
That's
statement?
that's not true. As a matter of fact, my son plays football.
I
think
agree,
the benefit of
Aunt
sport
Edna.
far outweighs those risks, and I say that because the prevalence in society for those with CTE is still quite low, even amongst football players who play recreational sports or at the collegiate level or even at the professional level. It's still around 3%. Which is very similar to other neurodegenerative or the prevalence of other neurodegenerative diseases. There's a lot of
Garbage
selection
Pail
bias with
Kids.
regards to CTE. That is because
I
people
vaguely
who
remember
have
that.
symptoms are generally with those who then donate their brain to find out if those symptoms are due to CTE. And more often than not,
Chili
they
over
find
mashed
CTE. But
potatoes.
overall,
Damn.
no.
That sounds
The
good.
prevalence is quite low. We know that there is probably a inherited genetic predisposition to develop CTE because in about 30% of those who have CTE, they have other comorbid neurodegenerative disease.
And would you expect to see evidence of CTE or some other abnormality such as that on the brain scans that were performed?
You could not necessarily see CTE, but you would see, with regards to chronic brain injury, what you're looking for, because the brain only has
Coca-Cola.
a single way really to respond to injury, right? Chronic injury for that matter, looks very similar regardless of what caused those injuries. What we're really looking at is the pattern, the topographical distribution of those injuries. And that really allows you to say, is this consistent with or similar to a pattern we see in CTE or a person who's had repetitive concussive
Anyone
injury?
listening? Yes.
And looking
Julie,
at
what's
those
up?
patterns, is that the same analysis you would do for someone with traumatic brain injury?
Yes.
I might have some cold
Now,
pizza soon if you guys keep
also,
talking
you
about
mentioned
it.
that you have training as a toxicologist.
Yes.
Now, are you familiar then with controlled substances and illegal substances and their effects on people's brains?
Yes.
Could you just briefly describe that?
Sure. I mean, most of your stimulant substances, your psychoactive substances act primarily through brain receptors or specific brain receptors, mimicking the action of endogenous or normal neurotransmitters. And a lot of the desired effects are because of how it affects our brain.
Now, would you agree that drugs could affect your ability to think or to plan and to cause you to act impulsively?
Absolutely. Yeah.
And would you agree that people can just do evil acts without having brain injury
Yes.
or without having a mental diagnosis?
Yes.
Now,
My diet
as part
starts on the
Dr.
9th of
Rubino's
this month, guys.
testimony,
Actually, the
he
8th
prepared
of
a
this month.
PowerPoint. I'm going to ask you in just a moment to come down. I want to ask you questions about this
Serious.
imaging. He mentioned 2 tests that were not performed. Do you recall which test he referred to that were not performed?
Specifically, he talked about neuroquant and he talked about CTE with PET scan.
Anybody that
looking
wants
at
to get on a
radioactive
diet
glucose.
trail with me, we're
Do you
starting on the
believe
8th
based on what you saw in the imaging that those
or the
tests
9th.
were necessary?
8th or 9th. Let's put it in the chat.
Why not?
Well, sure, because neuroquant basically is a computer program that we can use to process imaging, in particular DTI-based imaging, after the
Man,
imaging
that
is
sounds
performed.
good. Pin
And
a
it's
rose
really
on
used
your
to
nose.
establish a quantitative measure of the volume of a particular brain
Hi,
structure,
Carissa.
in particular white matter or white matter tracts in the brain. And really the only clinical or the only indication to do so is if when you're looking at the MRI or looking at the DTI imaging and you actually see differences that would require further quantitation. In this case, there were not any significant differences in the DTI imaging to suggest further.
I'm happy to
assessment with
do a diet with
neuroquantification.
you guys. I'm
The
going
same
to
thing
do
goes for
it.
CTE.
It'd be nice to have
with
some
PET
support
included because
and be supportive.
excuse me, CT with PET because you're looking to see if there are brain regions that are either hypermetabolic or hypometabolic, and those are usually brain regions that have some underlying pathology or injury. But in this case, these were normal imaging scans without any evidence of pathology that would require further specialized techniques.
So you
We
guys
also heard a
mind
lot
if
from
I
Dr.
smoke?
Rubino about brain symmetry.
Can
He
I see in the
cited
chat?
comparison treatment.
Sure.
And
Could you
just so you
just,
know, it's gonna
talk
be
about
marijuana. It's legal here in New York, but if it's
Sure. Well, it's
offensive
just
to you
basically
guys,
looking at
I'll
or
get off
comparing
the
one
screen
side
and
of the
do
brain
it.
to the other. And so I'll tell you with regard to this imaging. Now, just to give you a
I don't
little
wanna
background. So
trigger
I probably look
anybody.
at about 700 to 1,000 brains a year, and I probably looked easily over 10,000 brains in my career of all different ages.
Well, you're a show off, Aunt
Looking at a
Edna.
brain with my eyes and my hands is very similar to how we look at a
I
brain
used to be able to eat everything I
radiographically. So
wanted,
when
and
a
then I turned
person does a
50
CT or an
something, and
MRI, they're
yeah,
taking
it's
slices
been
of
downhill
from
ever
front to the
since.
back or top
Okay,
to
so you
bottom
guys are
or
cool with
side to
me
side
smoking. I'm gonna go
through
ahead
the
and do that.
brain
All right,
because they can't do it
let's go,
physically in
guys.
person, right? Whereas I can physically examine a brain and I cut the brain the exact same way that a CAT scan or MRI does. So we're looking at the same thing. Our appreciation for brain anatomy is the same. As a matter of fact, an MRI hopes to get to the, one day to the clarity, if you will, or the resolution that
I don't mind if you fart. Go ahead.
That being said, the problem with looking at symmetry on the PowerPoint is that you're looking at one slice. So if I can just give you an example of comparing, especially the ventricles, because the ventricles are
All right, got a
hollow
lot of
structures
potheads in the
within brain.
chat. Okay, guys, didn't know.
And if you can imagine,
Didn't
let's say
know.
two footballs placed here on the table side by side. We know that a football is conical in shape, right? So if you look at the front of the football, it's going to be, smaller. If I put a slice through both footballs, it's going to look smaller. As I move back to the middle of the football, if I put a slice, they're both going to look bigger, right? And that's assuming that I'm making that slice perfectly level with both footballs at the same
You know,
exact
he
level
explains
on the
himself so
horizontal
much
plane.
better than the
So
other
let's say if I
doctor,
just
right?
angle my knife just a little bit, where I get a little more of the anterior portion on the one on the left and a little more of the middle portion of the one on the right. If I look at that, one is going to look
Whoa.
smaller than the other. It doesn't mean that there's true
Just
asymmetry.
be careful,
It just
Lorraine.
means the level at which I'm looking at is not
Just
really
drive
relevant.
safe, Lorraine.
So you really have to get a volumetric analysis of the entire ventricle and compare one side to the other, truly say whether or not one ventricle is larger than the
You
other.
guys know
Looking
AG
at one
Tactical,
single
right?
slice
He's one
can't
of
do
my
it.
favorite
When you
creators,
look at the
right?
slice that he showed
I
there,
don't
you
know
can
him
clearly
personally, but
show
we've been in
that
touch
the
a little
hemispheres
bit.
are on different levels.
And
Specifically
I know
by
he
looking
smokes
at the
because he does
inferior
it live.
horns,
I
the
would
lateral
love to
ventricles,
do
you can tell
like
that
a
they were
case
not
with
level.
him
So to
and
take
us
a
both
measurement of
smoke
ventricular size
because I
at
think
that
that we would
particular
be
point
kind of
is
goofy
invaluable.
together
So it's
and we
hard to
would feed
compare those
off
two.
each other.
I would
He
ask
just
if,
strikes
at the
me
point
as
that
somebody
now
that I
you
could
can
do that
ask
with.
Questions about the imaging.
Okay.
If we could have the microphone moved over just so we can hear. Dr. Coyne, I want to go through the PowerPoint the Dr.
Yeah,
Rubino
Tracy, this is
prepared.
important though.
And
Watch.
these
The other
scans
doctor was
that
terrible.
we've
This guy's
also
good.
reviewed, prior to coming here today.
Yes, yeah.
So let's start with this scan. What do you note about this first scan?
This is a horizontal section
I
through
like
the
AG
brain.
too.
You're looking here at the ventricles, which look more white, if you will. And what he is claiming that there is asymmetry between these two structures. But by looking at the posterior horns here, you can see the length difference between the two. That's because this is not a complete level section through the brain. You're looking at a different level from the right compared to the left. So you're not comparing the same. So you can't make an accurate measurement here from one side to the other. You're going to get different measurements because of that.
And
So you have to look at the volume of the entirety of the ventricle.
And so based on that, do you believe there's anything significant?
No,
about this?
and I'll tell you further why, right? So if you had asymmetry in the ventricles, or let's say, for instance,
Thank
he
you,
also
Cloud9.
described that there was an abnormality in the size of the ventricles, that they were actually more narrow or smaller. They're not. This
I
is
love
actually
AG.
appropriate in size. And he suggested that because of that,
Thank
there's
you,
probably due to
Cloud9,
increased
thank you.
intracranial pressure. But that doesn't happen in isolation. Increased intracranial pressure is going to cause fluid from the ventricles as well as fluid from the vascular
He
space
was
to
eating up
spill
that
out
other
into the
doctor
actual
too. You
brain
see that,
tissue.
right?
And that's going to cause abnormalities in the CSF pattern, as well as it's going to
He's
cause
disputing the
hyperintensities
other
around
doctor.
vessels.
He's saying that
You see
that's
none
not
of
even
that
a
here in
fair
this actual
account.
scan whatsoever. Not to mention, increased intracranial pressure is going to push the brain parenchyma out. The brain is trapped in the skull. That's nowhere to go. So if you increase pressure inside that skull, the brain is going to be
I
pushed
love this.
outward and downward. And you see no evidence of
Thank
that
you,
at
pin a
all
rose
here.
on your
You don't
nose.
see any evidence.
Hit your
You see
DNA
the
on the
normal
like button,
pulsation
guys,
right here, or
in
the
case
normal
we need to
folds of the
find
brain.
you.
You have no evidence
Thank
of
you
that
for that,
increased
pin a
intracranial
rose on your
pressure. More
nose.
importantly, like I said, there's no overt
Cloud9,
evidence
have
of
a good day at work. Come
abnormality in
back and
ventricle
visit
size,
us.
and that matches what the radiologist saw on both the CAT scan and the MRI.
And what was the radiologist's opinion on the
Valencia.
MRI that we're
The
looking
Oh,
MRI
thank
was
you,
that
Aunt
there
Edna.
was
Thank
no
you so
difference,
much. I
in
really
the size of the
appreciate that.
ventricles. And that's important too. I know
Unnecessary,
Keith had
but so
mentioned that,
appreciated. Honestly,
normally a
so
person wouldn't make
appreciated.
comment of that on an acute CT. They very well would make comment of that because
I'll
if
do
you see
something for the
asymmetry
puppies or
on a
something
CAT
with
scan,
that, guys.
what it
Thank you.
suggests is that there's perhaps some underlying mass process that's pushing or changing the size of the
Danny's
ventricle
getting
that
her
needs
second
further evaluation.
heartworm
So a
at the
radiologist will
beginning
certainly make note of
of
that, and a doctor
September.
will certainly have to
So I'm
follow up with
taking
that.
9 days
He
off to
also
be with her. That's
mentioned
why we're
about
starting our
some-
diet
some
then.
issue
Thank you so
about
much, guys.
space
Thank you
between
so
the
much
skull
for
and the
this.
brain.
I
He talks
appreciate this.
about, yeah, sure. So this is a little bit higher
Thank
up,
you
so I
so
can't really
much.
see the temporal lobes here. But you can certainly look at, so here's the frontal lobes of the brain. The orbital frontal lobes are the part
Krista,
of the
thank
frontal
you.
lobes that curve
Thank you so
underneath.
much.
And normally when you're comparing the width of the sulci of the orbital frontal lobes, they're going to be a little bit wider than the normal sulci that you're going to see on the lateral frontal lobes, as well as the sulci that you're going to see moving posteriorly.
Let's
to
do
the
it.
temporal
Not
lobe.
sorry.
So what
sorry.
he's
Let's
describing
do
here
it.
is just the normal
No,
spaces
you don't.
between
Thank you so much.
individual gyri of the brain.
And Edna, I
And how do I know
appreciate
that?
you.
Because
That-
the
You didn't
cortical,
have to
so
do
if there
that. Thank
was
you so
atrophy,
much.
you would have loss of brain substance. You would have loss of gray matter and you would have loss of white matter. The cortical size is of normal thickness. There's no loss of cortical size. More
She's
importantly,
doing great,
the
Danny.
distance here is all normal.
It's too
So
bad
there's
because
no
of
loss of white matter underneath.
about a
here.
week I'll
You
be
don't have
telling her you
atrophy
can't
in
do
the
that. You
absence of
can't
loss
do
of
that.
brain
You can't do
substance.
that.
Brain substance is absolutely normal. More importantly, this is all the white matter from here travels down through the center of the brain into our spinal cord. If you lose substance, you get an increase in size in the ventricles. That's well known, and that's not seen here. So I see no evidence of atrophy at all on this brain. More importantly, when you look at the temporal lobe, he describes
So totally
changes in
contradicted the other
amygdala
doctor, and I
hippocampus.
believe him.
There is no atrophy whatsoever that I can see at all looking at
Which
this.
doctor do you
More
guys
importantly, any
believe?
atrophy,
One
if there
or
was,
two?
certainly I don't think wouldn't have any behavioral readout.
We could go to the next slide, please. What are we looking at here? Is this just more of him trying to say?
This is
he's
just,
gonna-
yeah, him using whatever program he has on his computer based on a scale that it has to
He's
measure
talking about that
the
doctor.
millimeter size
right?
or width of these ventricles. But like I said, look at the differences here between the posterior horns. It shows you that this is not on the same level. So it's slightly
He
off. So
manipulated the
you're getting
photo.
more of an
That's what it
oblique,
says.
tangential cut through here because again, like I said, you're dependent upon a person laying in the MRI tube.
Yes, he
Nothing is
basically
going to be
sees a
100%
normal
level. So
brain.
you really have to look at the entirety of the volume of the ventricle. So look at the volume of the ventricles at multiple
Give me all the
levels,
coffee.
not just a
and have
single
mine.
level, and take a measurement and then make an assessment of that. But like I said, if you did have alterations in this, then where is the alterations in the rest of the brain? We don't see that either.
And for the record, you were just referring to slide 3 of Dr. Rubino's PowerPoint. We're going to go to slide 4. What do we see here, doctor?
This is moving more anterior. This is moving more up towards the top here. Again, you're just looking at the white matter, but what we're looking at here, so this would be white matter tracks here. And again, he's talking about these spaces that you see here between the frontal lobe. Again, you could tell that they're at different levels, right? Look at the
I hear you.
sulfations different, but more importantly, the white matter pattern is normal. The width of the white matter, I don't see any evidence of atrophy there. More importantly, if you have trauma, let's say we're saying this is due to brain trauma. All right, this is due to a deceleration, acceleration type injury or direct brain trauma where a person has an impact and then the brain moves both linearly, slamming into the front of the skull and the bottom
Not
of the
sorry,
skull,
Charlie.
and then rotates about its center axis. And that causes a shear strain to the brain. Number one, it deforms the brain substance. And because the gray matter and the white matter are of different densities, they move at different speeds relative to each other, creating shear strain stress that affects not only the gray matter itself directly, much like if I punch myself in the arm, I'm going to get a bruise. And maybe if I don't get a big bruise, I'll get a little redness or definitely a change. Well, you would see that long term
I love
on
my
the brain
puppies
if you
too,
had a
thank you.
significant brain trauma. You would see hyperintensities, calcifications around small vessels. You may even see atrophy. More importantly, you would see an abnormality in the white matter pattern.
You
due
go
to
for it,
that
Katie.
trauma. Or you would see alterations at interface between gray matter and white matter, in particular along the long tracks that cross the hemispheres and go downward into the spinal cord and brainstem. And we don't see any of those changes here.
See, he's saying that's a good looking brain to me.
Number 5.
Mhm.
What do you see here, doctor?
This is just, again, another example looking at the ventricles and trying to make an estimate that there are abnormalities in ventricular size. Also, arbitrarily choosing one point versus another point. Again, you can't make an assessment of ventricular symmetry by doing that.
Go on to the next slide, which is slide 6. What do you see in this slide?
Sure, now we're looking more towards the base of the brain. Here's the temporal lobes right here. You're looking into what would
It's like a
be,
bat.
here's the midbrain right here. And it was
An
probably
evil
more
bat.
pons, actually, pons, midbrain to pons, cerebellum. More importantly, when I look at trauma in a brain of someone that's had significant impact trauma, I'm going to see white matter pathology very commonly in the cerebellar peduncular white matter.
Good morning,
brings,
Moonchild.
and brings them into the cerebellum. I don't see any changes of that here, but more importantly, I don't see any atrophy of the parahippocampal region or occipital-temporal region which houses the amygdala and the hippocampus. So no, I see no evidence of atrophy here at all.
All right, so if we could go on to slide number 7. Doctor, what do we see here? Is this just a further?
Yes, it's just another look at, yep, another level of that same region.
And again, everything appears normal in that slide?
Yeah.
All right, what about slide number 8?
Yes,
So
everything
this
he
is actually
did
a
was
great
by
just
choice.
image looking again. This is now the orbital or the frontal portion of the brain here. And again, this is normal distance or normal spacing between these gyri that you see in this part of the brain. More importantly, as I said, you do not see the atrophy that I normally expect to see when it comes to trauma. The asymmetries that you see here in DTI pattern are quite normal in individuals because there's a functional, there's a functional hemispheric differences in white matter pathways, right? So there are laterality in functions within our brain.
Yeah, he's just evil.
Because of
That's
our
all.
experiences, things we learn to do throughout our life. There's going to be differences in density of myelination and white matter
Yeah,
in
there
our
was
brain, which will
definitely going to be more than
present
one
as
doctor.
asymmetry. This pattern here
One
is
from
not
each
something that
side,
would
one
be
to
consistent
combat
with traumatic
the
brain
other's
injury.
story too.
Moving on to the last slide, which is slide 9. Doctor, is this just another?
Looking a little further backwards. Yep.
All right, and again, no abnormalities, nothing here
Yep.
that suggests any kind of brain injury.
Agreed.
Okay, thank you. You can step
I
back.
want to see what my brain looks like too, SD.
Doctor, based on your review of these scans,
Yep.
would you have ordered anything further if the
Well,
defendant was your patient?
As a radiologist, or just as a physician for that matter, I would have looked at these.
You're right,
as you
Sarah.
said, a normal brain. If I was writing up a brain pathology report based upon this,
And you're right,
I
Aunt
would call this
Edna.
a structurally normal adult
And
brain.
you're right,
and I
Tracy
wouldn't be concerned
O'Malley.
about anything,
Yes, yes.
significant to
All of the
chase
above.
after.
Now, another thing Dr. Rubino
He's
testified
evil.
was about lateral asymmetry on the 2023 CT scan
Mhm.
that was part of the medical records. Did you have the chance to review that?
Well, yeah, I did see those CAT scans. I know what he's referring to, and he's referring to basically the same asymmetry that we pointed to on the screen there. That is an asymmetry in the lateral ventricles, which were not noticed by the radiologist, and certainly I didn't notice any changes either.
So again, same assessment from 2023 as you've made now. There's no evidence of asymmetry.
Yes, I mean, our brain is not 100% symmetrical. When you look at one side or the other, you're going to see differences in just the general morphology that you can pick out with your eye. But again, it's really the total volume that matters. And in this case, that wasn't done. It's inappropriate to do one single measurement like that and then generalize to the asymmetry of a ventricle.
Now, the other thing he talked about was the difference in size of ventricles. Could you just explain whether that's significant or not?
So I know that there is certainly a wealth of literature out there looking at ventricular asymmetry and its involvement in psychiatric illness. The problem is that, still to this day, whether you have schizophrenia, bipolar disorder, or other well-known psychiatric illnesses, there isn't a neuroanatomical substrate
Thanks a
that
lot.
allows one to diagnose
you so
an
much.
underlying psychiatric condition.
Don't you like her name?
So we
Put a
can try
rose
to
on your
generalize
nose,
by
Gracie?
saying, well, this brain region is involved, we know that this brain region is involved in these types of behaviors. So therefore, if we see a change here, we would expect to have this kind of behavioral abnormality. But that doesn't necessarily always hold true. There's certainly a lot of compensatory changes from one side of the brain to the other. And again, like I said, there's different functional reserves from one person to the next.
And again, based on the CT scans and this MRI, you saw no evidence of any sort of.
I did not see any evidence, and more importantly in this, I didn't see any limbic system atrophy.
Nothing wrong with you, Wade Wilson, just
Any
evil
damage
to
the
the
amygdala or
core.
hippocampus?
I did not.
Now, the other thing that Dr. Rubino
I'm
testified.
just to add one thing, not only just the hippocampus and the amygdala, but the nerve fiber tracts that are important and integrate with that, the fimbria, the fornix, as well as the surrounding white matter.
And those are all normal.
Yep.
Now, we talked about the MoCA.
His
test,
face
and
scares you. Which
one of
tattoo is
the
that, Sizzle?
Assessment.
Mhm.
How would you describe the MoCA test?
Well, clearly my patients wouldn't respond well to that because they have no pulse. But what I would say, that's certainly something that someone uses as a upfront, quick
Shark eyes,
assessment.
that's
It's
right.
certainly not the.
He got
I
them
wouldn't
shark
base my
eyes.
diagnostic or my diagnoses, on that. It would clue me into what I should do further.
Dead
In other
eye.
words,
Yep.
if I'm doing an initial assessment of a patient and I see, hey, there may be a problem here with short-term memory or concentration, then I would do additional neuropsychological testing to really hone in on those abnormalities. A snapshot is a bad thing to make any opinions on, especially in this case because of the setting. We already discussed, and he even alluded to that when he performed the test, that there were guards overlooking Mr. Wilson, that he appeared nervous or anxious. That would certainly, cause an upregulation in your sympathetic nervous system or the activity of our sympathetic nervous system, which antagonizes normal short-term memory. We can think all of us, if we were taking a test and we had someone looking over our shoulder, we would be much more anxious, and our ability to think through that test would be more difficult. And even you could talk to law enforcement officers who would tell you that, in situations of stress, when your heart rate goes up and it reaches a certain level, your ability to concentrate and think is decreased. So the same thing in this scenario. It's hard to really draw conclusions about one person's short-term memory from a single assessment. Furthermore, same thing with the cranial nerve assessments. If a person is shackled or in a setting where they're not able to truly, really give a true clinical examination. And lastly, I'll just say, again, reflexes and things of that nature. Sure, a person. Dr. Rubino has been doing this for 20 years, but understand that there is a subjective portion of that too, right? One person's 3+ out of 5 may be another person's 4+ out of 5. So there are individual differences, even in the clinician who's doing the.
He's trying to be
performing
kind.
the test.
So you brought up
He's trying to be kind to the other
weakness that's
doctor.
subjective.
He's saying under his breath, what a moron he is. Like, that's what they got for $400. I was ready to do it for $2.
You're doing it in an objective way without making some sort of criminal analysis or criminal finding.
Sure. And actually, the first part of the radiologist report, and the same thing with the pathologist report, is going to be the description. You're going to just give an unbiased description of what exactly you are seeing. And then in the impression, you may give your impression as to what you think may be going on. But again, that's from a medical perspective. That's me letting the other clinicians know, hey, this underlying pathological process is probably going on, so you need to do additional tests. But we don't think about it from that perspective.
So when Dr. Rubino testified that he didn't want the radiologist to put his or her opinion of what they saw because they might be wrong, and he's looking at it from a crime point of view.
I think that they don't have the
I
PET
would
scans, but
take
they
the
do
front of
have
that as a
some other
pathologist.
stuff
If someone
done
told me not
from
to give a
before and
diagnosis
after, I
on,
think.
on a slide I looked at or tissue I examined, because I had the requisite training to do that. I went to school and did many years learning how to properly interpret that particular test.
I agree,
Another
Babs.
clinician hasn't. And so they shouldn't make an opinion above a radiologist. They should use the radiologist as a consultant to help them guide their clinical decision making. But they don't have the capacity to make a better decision than a radiologist does. That's my clinical opinion.
Now, going back to the MoCA, I got sidetracked a little bit.
He was dismissing the radiologist, the other doctor, remember?
But would you agree that the MoCA is simply just a
Made a
screening
mistake.
device?
Yes,
Bloody
So
radiologist.
it's not actually considered a diagnostic.
it's one of the many tools that you would use in formulating a clinical picture.
Now, would you agree that a lot of different testing that a physician might perform or a psychologist might perform, that there are certain standards or certain requirements in order to perform that test?
Yeah, and every test that we do. Yeah.
And what is the purpose of being properly certified to administer a test?
Well, it's
Right.
reliability, number one. I mean, you want to make sure
I
that
wouldn't
you
call
are
you a
appropriately
ditz, but
administering the
he makes
correct
things
test
pretty
in its
simple to
correct form.
understand.
So the answers that you elicit are can be, actually examined, right? And utilized. And then you need to have some sort of inter-test reliability that your test is being performed the same way somebody else would be performing the test. Therefore, you can compare your answers or your results to somebody else. That's the only way you can truthfully arrive at a diagnosis that can then be
First, you'd have to find a
approach for
brain
treatment.
in her. Not so
would you
sorry,
agree
Charlie.
that, in order to administer a test based on testing requirements and testing standards, that person should be administered and how to give that test?
They should be, yeah.
Now, Dr. Rubino testified about essentially his opinion was based on the MOCA failure in conjunction with the MRI. Again, did you see anything when he says in conjunction with the MRI? Was there anything significant about the MRI that would suggest?
Several things I'll point out. I mean, I know he saw the MRI findings and he made the assumption that there was atrophy of the frontal lobes as well as the anterior temporal lobes, which I did not see any evidence thereof.
Yes,
Furthermore,
with
the radiologist didn't see
microcephaly,
any
it sure
evidence
is.
thereof.
But I
And
still
he
don't
made
think
the
we've got to
assessment
work
that
on.
that was due to a history of trauma or chronic traumatic injury. But looking at those brain scans, I can clearly see that there is no evidence that I can find of traumatic or the patterns that one would expect to see in chronic traumatic brain injury. Furthermore, he goes on to talk about the hippocampus and the amygdala, which those being in the limbic center were somewhat atrophic and therefore can be used to explain perhaps a person's impulsivity. But I did not see any changes there in the amygdala or hippocampus to support that suggestion. Going on even to the cranial nerve exams, I know he had mentioned.
Don't you
the,
wonder, like,
Parsec,
what's going through his head right there? You know,
jerk
he's not
nystagmus,
listening to this
horizontal jerk
shit.
nystagmus, as well as the
Don't you
cognitive
wonder, like,
rigidity.
where he's at in
I
his
think he had
mind?
looked at or said earlier that was somehow supported in the MRI, but we're talking about brainstem function here, specifically nigrostriatal extrapyramidal
He
motor
is
system, which
disgusting.
he said, sometimes we see in
But you got to
Parkinson's, and
wonder
that's true. That's more ventral
what he's
midbrain.
looking
You
at
saw
over
the picture of the
there.
midbrain in there. And that's not something
You
that I
know,
would
like,
see
what's in his
specifically in
mind?
trauma. In other words, if forces are
Clearly,
directed towards the
not
brainstem, I'm
much,
not going to
but
only see injury to the midbrain, I'm going to see injury as well as to the pons and medulla, which are structures that are continuous with that. I'm also going to see it in the white matter structures that are communicating with that structure. And we see no evidence
he's all of those
thereof.
things.
More, if
Disgusting.
you do see extrapyramidal motor system defects, I could argue more importantly that it may be very well related to hypoxia or even drug use because
Where's the cameras? Where's the
certainly,
cameras? Where's the Wade
increased dopamine
Wade World
signaling in that
women?
part of the brain
Where
we
are
know
the
is
wacky,
associated
willowy women
with
that are
toxicity.
supporting me?
Dopamine itself
Which way
can be
is the
toxic.
camera going?
Dopamine, the metabolism of dopamine by our brain produces semiquinone radicals. It produces oxidative stress, leads to damage to that part of the brain.
Leave
More
it.
importantly, hypoxia can as well. We know people who survive cyanide poisoning have Parkinsonism type behavioral characteristics afterwards. And that's again, because that region is more susceptible to hypoxia, more importantly, reperfusion. So let's say if you had an episode where you stopped breathing or were on drugs, let's say opiates and breathing very slowly and then suddenly restored function, that reperfusion there could produce injury to that brain region.
Okay,
And that would be more
Misha,
consistent with the
get away
findings
from the
on
woman
cranial
smoking
nerve exam than
weed.
trauma, because I don't see any other associated findings or even imaging
That's
findings
it.
that
That's
would
what he's
lead me
doing.
to
He's
believe
trying to
trauma
look
caused
good
it.
out there. Where's the
So
camera?
as
Where's the
far as
camera?
brain scans, they're not consistent with that finding.
Yes, that's correct.
And I know you already talked about reviewing that CT scan.
Exactly, right?
23.
I just can't believe he's
Referred to
sitting like that. Like,
incident as head
how
trauma, but was there, in fact,
disrespectful.
any evidence of head trauma?
He was no, and so certainly from an acute perspective, no evidence of trauma to either the head, the skull, the brain's coverings, or the brain, and certainly did not see features that would make
He
one
is in the
think or
kiosk. Yep,
suggest
he's
a
waiting.
chronic brain
He's thinking
trauma
about
would
all
occur.
his stuff when he gets
And
back.
again,
My honey
atrophy would have been
buns.
reported on that.
My
CT
hot
scan
sauce,
has
my
been
noodles, my
certified.
Yes,
ramen.
especially, because of the presentation of the patient at that point in time. You're trying to figure out,
No,
what's
no, no.
causing this
And
patient's
Edna, let
underlying
him fight his own
condition. If there
battles.
was
Come
a period of hypoxia
on.
related to, let's say,
I don't think they
drug
should
usage,
protect him.
that would
Honey
be very
buns on the
And was he in
brain.
fact hospitalized for
Hot
overdose to the jail
sauce.
on fentanyl?
That is what I read in the records.
Now, looking at that scan in 2023, would you have ordered any additional testing based on the radiologist's findings or based on your review?
Based on the radiologist findings, no.
Telling
I
you,
would
man, I
have,
think he
looked
got popped in
elsewhere.
the
In other
lip.
words, I would have determined from that point in time, there was nothing for me to be concerned at within the skull.
Now, another thing we heard about today is these self-reports that the defendant gave of being in car accidents and sports injuries. Did you find any actual evidence of those things or those incidents?
If there was a significant head injury, impact trauma, leading to either subarachnoid bleeding, which is
That's what I
bleeding,
say.
on the thin
Here,
coverings that
here.
immediately surround our brain, and would make sense, right? If you're in a car accident, your head slams into, let's say, a windshield, your brain's also moving at that same speed.
He should be
it will
force-feed
slam into
spaghetti
the
for the
skull.
rest of his life.
And that
Ruth.
will produce can produce a bruise.
That's
on
the
brain
only meal
itself.
they
So you
should
would
ever give
see
him.
hemorrhage
Fucking
in the brain
spaghetti.
tissue, but you may also see a tearing of the
Sorry about my
tissues that
language.
surround the brain, causing subarachnoid hemorrhage or subdural hemorrhage. I know it's a long explanation, but the point is that I saw no evidence there of that having happened.
Okay, and going back to those injuries though, would you agree that those are all just self-reported, that you never saw any medical records or admissions records or anything to support that he had in fact been injured?
I would agree, because looking at the imaging, I wouldn't predict that there had been significant prior brain trauma.
And the other doctor said something different, right? And then they ate him.
So
Cut him up and ate him.
based on all of your review of the records, based on the review of the scans, based on hearing and looking at Dr. Rubino's report, let me just quickly before I actually ask.
You guys
the
got to
question,
remember that one
was
woman was
Dr.
just on her
Rubino's
way to work,
report,
and this
believing that
fucking
he had
idiot
traumatic brain injury issued
asked her
prior to any
directions,
scans?
got her
No.
in the car. He probably
I
said,
thought,
"Oh,
no.
let me
I
give
mean,
you
so
a ride,
his
ma'am.
report-
Thank you for helping me. Let me
I
give
only
you a
came aware of it
ride."
yesterday.
And
but-
that was
but,
the only thing she was guilty
his
of.
report, I believe,
She
was
didn't come
based
home to
upon
her
the
son.
results of
That was
scans
the
that were
end.
performed by-
Diane Ruiz.
That's what you're asking. I'm not too sure. I'm sorry.
So when Dr.
And then he
Rubino
gets out of the
issued
car
report, I
and he
believe
realizes
they
she's
sent
not
to you, and that report
DEAD. So that's when he
was
runs her
scans.
over.
Okay, yeah.
So
Yeah.
that report was,
Piece of
he
shit.
concluded he believed that a brain, there was some
It's a
sort of
piece
brain
of shit.
trauma. Was that conclusion then before?
Shouldn't
we
be
actually
walking
got
around with other human
I
beings.
believe that
There's nothing human about
conclusion
him.
was based upon his assessment of him physically.
So not including those
Not-
scans, it
not
was
including
just
the
his
scans, yeah.
physical assessment.
Yeah,
He
that's my
believed
belief.
it was
Yeah.
traumatic brain injury, ordered the scans, and then that's.
Yeah, but I heard he
Because
likes
got the-
boys.
He had the history
And that's
from
all
the
right. I'm a
patient
gay
telling him
woman.
about
I heard
his
he
history
likes
of trauma.
boys.
He did the cognitive
shit don't
assessment as
bother
well
him.
as the assessment of motor skills. Made
Somebody
the
needs to
assumption
just
that
beat the
there was
living hell out
significant
of him
brain
every
trauma
day.
and then
He
have the
needs to
scans.
wake up and realize he's going to get the
Dr.
shit
Rubino,
beat out of
do you
him
believe
every
it's
fucking
appropriate
day.
To make a diagnosis of traumatic brain injury before seeing any current scans?
Yeah,
Not
I
a
heard her
diagnosis. You keep it in
son
what we we have a differential
about his
diagnosis or a
mom.
working list of potential diagnoses
Heartless,
based upon a person's
soulless,
history, as
merciless
well as their
piece
presentation,
of
their clinical
shit
presentation. And so you make a list of possible things
that
that can go wrong.
women are
And
fawning
obviously,
over, fighting
brain
over,
injury is in one
pining
of those
over,
categories of
giving their
dysfunction, right?
money
think about
to.
prior
This piece of
ischemic
shit.
injury. Ischemic meaning lack of blood flow to an area of the brain, not necessarily a stroke. A
Oh
stroke could
yeah,
be one
he's
of the
had a few
causes, but
boyfriends,
you look
Michelle.
at-
I'm
you
not
think of
being
mass
funny.
lesions, you think
I'm
of,
not being
for
funny.
instance, prior drug overdoses or exposures, and you put trauma on that list, but you don't make a definitive diagnosis. You have a working list. Then you use your other modalities to sort of narrow that down. Hey, I'm looking at these imaging here.
Look, the guy sits
Any of the
like he's
patterns here
watching
suggest
like a
one of
football
those
game or,
diagnoses.
you
And
know,
certainly the
I don't
patterns
know.
that you normally expect to see.
He's sitting
traumatic
there
injury
like
were
he's
not
watching
present
All in the
those systems.
Family.
So now
I
final
loved
question.
that show.
Based on Dr. Rubino's testimony here.
I don't know
today,
how old his
based
son
on your review
is.
of the medical
I don't
records,
know.
Based on your review of the MRI and the
But
CT
his son
scans,
shouldn't have
what
anything to
is
do with
your
this. Yeah,
ultimate
I mean,
opinion
his son
as
didn't
far
do
as
this.
whether the
His son,
suffer.
they shouldn't have pictures of his son. Let his son
I
live
saw
his
no
own
evidence
life.
that there was any underlying structural abnormality to the brain.
Yeah,
that
so
would be
his dad
consistent
said
with
that out
chronic
loud.
brain trauma. So I would say no. To me, it looked like a structurally normal brain.
His dad
Other questions?
had said that he's afraid of men. I mean, he put it out there so everybody knows that he is a wuss when it comes to
Morning,
men.
how are you?
He is a bully when it comes to women. So everybody knows that now. The death penalty is on the table. That's what this is about. And Edna, this is what they're trying. So the jury, 9 out of 12 in
Tallahassee,
one of the
Tallahassee,
cases
District
said
2.
he should be put to death.
Um,
10 out of
You're still
12 for the other
doing that?
woman said
Yes.
he
How
should be
long have
put to
you been-
death. Now
I've
the
been there
judge
since,
decides,
May
should he
1st.
be put to death? These scans are to prove for his side that he has damage, that he had sports injuries, that he has damage, and that he couldn't control himself, and that was going to be his defense. However, I don't think he's going to get the death penalty because that was not, the death penalty was not on the table. It was not there when he committed these crimes. He would, I think he's going to be grandfathered into.
No, I looked
well,
at the CAT scans and the MRI without forming, as
I-
I always do.
if I would have known the
Before I
death
form an
penalty was
opinion
on the table, I wouldn't have
even on my
committed these
autopsy
crimes.
cases or cases that I perform in
So,
neuropathology
It's
examination on,
after
I
that
do not
that the
like
death
looking at the
penalty
history
became
before I
on
do
the
an
table.
examination
So
because
he
I do not
could,
want to be
by
biased
law,
as to what I am seeing.
be
I then go
grandfathered
back
in
and I
because
look
at the
at the
time there
actual
wasn't the
history
death
or what
penalty.
we
You
think may have happened
understand?
in the person's
That's the
past to
only
see if
hope
I'm
I
seeing any
think he
features that
has.
would agree with that. But in this particular case,
And
no.
that,
I
unfortunately,
looked
I
at the brain
understand,
scans and
you
looked at the
know,
brain
that I
scans just like I would
understand
look at
it.
an actual brain.
If,
And I made
if
my
you're covered by a
diagnoses and
certain
compared to what
law
Dr. Rubino had said.
and then the
and
law
then look back
changes,
to
it
see if I
shouldn't
could
affect
figure out what he
you.
was
I
referring
mean,
or how
it's
he arose
unfortunate
at those
in this
conclusions.
case, but I
and I
do
didn't agree
believe
with those.
that more than I believe
You
this
didn't
horse
agree
shit.
that there was the atrophy.
That's true. Yes,
Yes,
because
he will be
again,
locked up for the
atrophy
rest
doesn't
of his
occur
life,
in
and hopefully
isolation,
he'll get his
right? So
ass
atrophy
walloped
has
for
to
the rest
happen
of his
for
life.
a reason.
Just
Yeah.
what is atrophy?
Sure. Atrophy just generally refers to shrinkage, right? So loss of normal size. When we're talking about the brain, atrophy refers to loss of substance or brain tissue, in particular, the neurons that make up that's the sort of the most important unit of the brain are the neurons and then the associated nerve fibers.
As you get older, doesn't your brain shrink naturally?
So the
Not
brain
naturally,
scan
pathologically, but
was
yes,
last Thursday.
It will atrophy. Yeah.
And the judge allowed it
On those
last
images that-
Thursday
that you just looked
because
at,
the death penalty is on the
front-
table.
frontal
I'm
region,
telling you
there's a
what I
dark
think,
areas.
but it's also,
that
the death
part
penalty
of the
was not
atrophy?
No,
enforced at the
you're
time
looking
he
at
committed
different
his
T1 and
crimes.
T2 images.
It's
The
only
dark,
been since
normally
he's been
fat lights
incarcerated
up when you go
that
to
that law had
T2.
changed,
Water and
or that
fat will
that
light up, and
sentencing had
so
changed.
you're looking at
So
just
I'm
the
only
different
going
types
by
of
what I know
MRI
it's
images,
facts
but
and what I think,
there
but I
wasn't
don't
any
know what's going to
abnormal
happen. He
white
might
matter
say,
pattern that I
listen,
can
fuck
see. But more
that, and
importantly,
he's getting the
it
death
isn't just
penalty.
so if you have a
I
dark
just don't
area,
know by
you
law if
have
he
to
could
have a
do that.
correspond. Which, if you're saying
But in
that
the
a dark
meantime, in
area of the
case he
brain is
can
due
do
to
that,
loss of tissue,
they got a
well, then
defense
you also
saying,
have
well,
change
he's
in the
got
tissue
brain
around it,
damage
right?
and he
So,
can't be
in
held
other words,
accountable for this, so
tissue gets
therefore he
lost,
shouldn't get death. Maybe
uh,
he should just get
infarct,
life.
trauma, what have you.
But if you
There is
listen to what his
hemorrhage,
dad said,
inflammation,
his
then you have
biological dad,
scarring.
Wade Wilson's
And so you have a
biological
change in the
dad said,
morphology of the tissue around it.
Wade does not
tissue
want
in this
life. He
brain is
wants
normal.
death. So then
There was
who
no
hired
atrophy,
these
abnormal change in the
doctors to
gyri.
fight for him to get
So
life?
there was nothing that I could see that I would
Doesn't
attribute
make
to
any
atrophy.
sense. This is the Wade Wilson
Yeah.
show. It's a shit
think
show.
that
Wade's World, Wade's World, party down.
Uh,
Get your popcorn and let's flip
August
the
21st.
switch. Zing.
If
There is no old Smoky
Wilson
anymore, by the
had
way.
suffered
It's a lethal injection from my understanding.
traumatic brain injury, and I'm not sure how you level that.
Sure.
But I mean, not everything is a complete blow to the
Yeah.
brain. But if he did suffer that, and it could regrow, regenerate,
Well,
fix itself?
the brain doesn't regrow. The brain has a very limited capacity to regrow, at least with regards to the nerve cells or the neurons, right? So
I agree.
ultimately, the central nervous system, when we have injury or loss of nerve cells, you have replacement of that by scar tissue, and the scar tissue in the brain is called gliosis, or the astrocytes fill in that void. That tissue never regenerates. There are areas of the brain that have stem
Yep,
cells, but
they raise not much
really do
money
not
for this.
contribute to reorganization of the brain
Monster.
following injury. So when you have injury and loss of
Do you know
tissue,
what $90,000
essentially
could have
forever.
done for the victims
But
families?
that doesn't necessarily.
Nice headstones,
mean
nice place for them to
the
go and visit their family.
impairment
You know what I'm saying?
in the brain
Maybe,
works
you know,
around the,
let somebody take a year off, get their shit
Um,
together,
Impairment with regards to what? Are you saying to the when
get
the
some mental
original
health.
injury occurs?
Correct.
Nope,
So when you have a
$90,000 to that
concussive injury,
fucktard.
let's say,
Pardon my
really is
language.
injury to the white matter of the brain, right? And when you have a
Mom, if
concussion,
you're
you don't have to
watching,
have cell death or loss of those neurons, right? You can have a disruption of the cytoskeletal
yes, I
elements
think
on
that
the
they're outside.
inside
I
of
did
those
see,
nerve
so
fibers.
guys, I did
And that
actually see
disruption of
some
the normal
video of
cytoskeletal
some
elements
crazy
causes
women
abnormal
outside of the
flux of
courthouse, I
ions,
believe.
swelling of that
I
nerve
saw
fiber,
that.
and therefore the normal
Well,
electrical
I was
signal
getting
that would
on
move
here,
from the top of the cell
you know,
to the
getting
bottom
on the
of the cell is
channel.
disrupted, right? If not impeded. And so while that process is repairing, it's not regenerating, it's just slowly going back to normal. That can take weeks to months.
He
The
shouldn't be
cell
able
then
to
is returned
profit
to
at
its normal
all.
state, but the cell itself doesn't die. So therefore,
Absolutely
you're not
right.
actually losing and regenerating a cell. You're just allowing for the normal repair process to occur. You're allowing for the inflammation to subside. Now,
Hey,
if the injury is
Dargy, is
severe
it
enough,
Dargy or
you would
Dargy?
lose cell tissue, and that's
Stupid
irreversibly lost.
Wade
It really comes down
Wilson
to the amount
fangirls,
and level of tissue.
absolutely stupid.
Let's
Are
say
there
he did have
supporters outside
trauma
the
to his
courthouse?
brain
I
and he did
believe
have
so.
concussive injury with loss of tissue that's not significant
Sure
enough for
from
me or
text.
anyone really to see here on this imaging technique. You know, you're probably going to have to look
They
either
need their brain
microscopically or
scanned.
use really,
Yep,
really
we're gonna go. I like
sensitive
that.
techniques. But even so, if it's severe enough to produce
Dargy.
abnormal
All
function,
right,
you
listen.
should see it.
I don't know
on
if
the
it's a
imaging.
hard G or not. Sorry. I could say Dargy or Dargy. Is it like the G in dog?
Pre-existing.
Tell me that.
injury,
Yes or no?
They were quite some time ago.
Sure.
Okay. Now, what happens if you have
Hard
pre-existing
G.
injury
Okay, Dargy.
and you add Flocka to the mix? Let me ask you, what is Flocka?
Well, it's that very similar to the sort of novel psychoactive stimulants. It's sort of they
This is
have
a
somewhat
drug, Flocka.
stimulatory as well as hallucinogenic effects.
Flocka makes you crazy. No
And/or
excuse.
cocaine, let's say. What effect would those have if you've got pre-existing minor, not necessarily,
Then he shouldn't do drugs if he can't handle it,
Traumatic,
man. You
Well,
can't do
It's
that.
very
Fuck
hard
that.
to
No, no,
predict
no, no,
because
no.
it really depends upon what structures of the brain are injured. And
So
where
guys,
there's
now you
minor
know that I
trauma happening.
definitely do not
Because
get
cocaine, is
a
going to
little
cause a
smoky
massive
before I do my videos because you
alteration
can clearly
in
see.
brain dopamine, right?
I gotta watch my
And so that's
impulse
primarily going to
control.
affect, your with respect to cocaine limbic system, perhaps
excuse me,
some.
I apologize. What's limbic system?
Oh, sure. Those are the
Flocka is
structures
not
of
the
our
same
brain
as cocaine.
that include the hippocampus as well as the amygdala, the
That's right,
mesiotemporal
Julia.
cortex,
That's
structures
right.
of the brain that are interconnected there, and they really are involved in our emotions, our
98 years
emotional
old,
learning,
man.
as
God
well as
bless.
short-term
God
memory formation.
bless.
Those structures are involved in
Guys, I gotta go to
taking
the ladies' room. I'm
our
sorry, I'm
environment
drinking
and sending
coffee
it on
like
short-term memory to
crazy.
become long.
I gotta
But
go.
to answer your question about drugs and their effects, drugs will have adverse effects on a normal brain, right? It really comes
Sarah,
down to not so
I
much
used to
brain
do
structure.
drugs too. I
As
didn't
it
do
works at the
everything
molecular
he's
level,
doing.
right?
Never did Flocka or anything like
People that
that.
have
And it didn't make me
our
behave
drug
like that. But let me tell you
metabolism
something.
enzymes
Alcohol can make
play a
somebody
role.
behave
Our drug
crazy and
receptors and
nutty.
how well
You
that
know?
drug can bind to a
Thank you for
receptor
letting
and
me go,
activate that
Sarah.
nerve. So it goes much deeper than that. But drugs themselves can have, you can't predict how prior brain trauma would affect the effects of a drug. It really comes down to what areas of the brain are injured.
So in other words, nobody knows what the effect of
Yeah, it would, yes, it would really be on an individual basis and yeah, and there's so many variables there. It'd be hard for me to answer that.
One moment, Judge.
You may.
I assume some of this, but I'll ask you.
Sure.
Have you ever met Mr. Wilson
No, I
other
have
than in
not.
court?
No, I have not.
Have you conducted any testing on Mr. Wilson?
No, I have not.
Did you review, other than what you've testified to from Dr. Rubino, did you review testimony of any other professional witnesses?
Oh, with a foot.
You reviewed the test results or at least the imaging from Dr. Rubino?
Yeah, absolutely hate
I
alcohol,
reviewed the images
guys.
that he reviewed also, as well as the medical records that had the radiologist review. I heard and I read what Dr. Rubino said about it from his deposition.
Cheriform Tex.
Did you ever
I've been
review
smoking for a long
an
time
MR
too.
the
I'm
MRI of
61.
Mr. Wilson?
It just
I
makes me
reviewed,
sleep
yeah,
or
all those
clean.
images.
And there were what, 8?
They're just reaching and
There were
they're
several-
just reaching.
Several imaging studies that were performed. Yeah, I can't recall the exact number. But
Yeah. Once in a while, Gracie, I like a beer with hot wings.
Did you prepare?
You know, like I like a
what
Corona
you
with lime.
Review. Did
with
you
hot
prepare
wings.
any,
That's it.
images?
Once in a while, there's beer in my refrigerator
Just
because
your testimony?
once in a while I
no,
like to
just,
make
my knowledge and
beer
my knowledge
battered
of the literature
fish,
and my experience.
and I do use beer for the beer battered fish. Smoking, my brother does too. It's the only time he cleans.
Are you aware
Sarah.
of any psychiatric or neuropsychological diagnoses in this case?
In this particular case, no, I did not review.
Why?
those
Why?
reports.
Maxine, you mean to tell me it's not legal over there?
And you're not qualified
I like Bloody
to
Mary mix, but,
controvert
and I have Bloody Mary mix.
diagnosis by either Dr. Rubino or the.
Thank you so much. I'm 61, Sarah.
Well, when it comes down to looking at brain structure, absolutely I can. That's my job.
Okay.
Smoke, Carissa. Smoke. Don't drink.
Now, if Mr. Wilson is impulsive based on the addition of cocaine or
Just got
cocaine,
legal here in Germany this year, but has many rules still on it. I stopped
he's
drinking because
unable
dot,
to
dot, dot, dot.
recognize implications from his conduct, are you saying that, in your opinion,
Thanks,
the
Laura.
MRI does not support that?
I'm afraid not Tadia Spritz area, but
Well,
backwards.
So take a step
You're
back.
kidding, you're-
How
Wow,
cocaine or any of those
Well, I'm not moving there now.
psychoactive drugs can affect a person. Certainly we know that they can.
I didn't know
phenocopy
that.
All of the positive and negative symptoms that we see in schizophrenia. as well
Yeah,
as the
too much
psychoses that we
alcohol,
see
man.
in
That'll destroy you.
bipolar
That
disorder.
turns people
Within that
into
realm
so
of,
many different things.
Behavioral activity, one
You
would
know,
expect to see
somebody-
agitation, impulsivity, and other abnormal behaviors.
That's one
while under the
person
influence
could
of
be
those
one
drugs.
way, and the minute they
those do
hit
not
that
correlate
drink
with
that's
having to
too much
have
for them, they're another
abnormal imaging
way.
findings.
Weed
That
does
can
not
occur
do
in a
that.
structurally
Weed
normal brain.
does
It
not
has
do
to
that.
With the effects of the drug interacting with our brain receptors.
So you can have.
So you can have a normal brain and still exhibit those behaviors. And I didn't see any. changes
Everybody
on the
that's
brain
in
that would,
recovery,
be anything that would deviate significantly.
good
from
for you,
normal.
man. Good for you.
Thank you.
Good for you.
Thank you very much.
All right.
And yes, we are
All right, so
pot
we can sit down.
smoking
Thank you.
channel. Those of you that want to indulge, please do. If it's not legal in your area, please do it privately and
Any other
secretly.
witnesses from the state? All right.
It
So
is
any
legal
other
in the state of
witnesses or
New
any other
York.
Evidence of any mitigating
It's illegal in
circumstances under
Ireland.
Spencer
I guess
that
I'm not
the
going there
defense would like
either.
to have the court
3
consider
years
this?
sobriety. Charlie, not sorry. Well done, you. Well done, you. Good job, you. Look at this. SD, 5 years. Good for you guys. Good for you guys.
If you want to present argument now, and I'll give you an opportunity to address the court again at sentencing, you can do both.
9 years narcotic free.
Sure,
That is a
whichever you would
big
like.
deal. Good for you, man. Good for you. Thank you so much. Pin a rose on your nose. Seriously, guys, congratulations on your sobriety as I smoke weed on the
Okay.
channel. Again, if
You're
it
welcome.
screws
Got a
any
great
of you
result
up, reach
this
out to
afternoon.
me and tell me. I won't get
All right,
upset.
then.
I'll
At
be
this
more
time, then,
careful
we'll be in
about where I
recess,
smoke.
Until 2 o'clock this afternoon, and see you then.
So he's coming back at 2 o'clock, guys. They're coming back at 2 o'clock for the sentencing. I will be here. I will be here for the sentencing. He is all chained up with no place to go, guys, with no place to go. All chained up with no place to go. He is a big boy. He says he's 6'5". His dad said that's a lie. He's 6'3". 2 p.m. Eastern Standard Time. That's correct. So it'll be in about 3 hours. We're going to be up for that. Bye, guys. Bye, guys. Bye, guys. Laura Lynn, thank you. You didn't have to do that. Guys, I so appreciate these super things that you do for me. I want you to know that I know that everybody works hard for the money. Thank you so, so much. Florida does have the death penalty. They have it on this. They have it on this. They didn't always have it. I thought that they did, but apparently they didn't because, and you know what? That's what I'm going to do. I want to look into this and see why they had stopped, if they had stopped the death penalty for a period of time, because as we know, Ted Bundy, toddy1skip@gmail.com, Gracie, Ted Bundy was put to death there. Eileen Wuornos was put to death there, right? So I don't know when they stopped doing that, but apparently they stopped at one point. You guys with me? Let's check it out. I'm going to check it out on my phone. Let's see. Whoa. Okay. Death penalty, Florida. Let's see what they got to say. Florida allows inmates to choose whether they will be executed by electrocution or lethal injection. I said something different, right? Because I didn't think that they were doing that. In January 2000, the Florida legislature passed legislation that allows lethal injection as an alternative method of execution. Okay. So they do have Old Smoky. Old Smoky is still there. The last execution in Florida was October 3rd, 2023. And he died by lethal injection. Let me see. I want to know why he wasn't originally supposed to get the death penalty. Let's check this little bastard out. All right. A jury found Wilson, 30, guilty on June 12th of the murders of Christine Melton and Diane Ruiz. And after weighing aggravating and mitigating circumstances, they recommended the death penalty. A jury recommended like I said, the 9 out of 12 and then the 10 out of 12. But I want to know why this was grandfathered in. Like, here we go, here we go, here we go, here we go. I think I found it. I think I found it. Wade Wilson is first Florida killer to face death sentence since DeSantis law changed. So there was something up. Wade Wilson, the Florida man who could be sentenced to death on Tuesday, that's today, is the first convicted killer in the state of Florida to face death after Governor Ron DeSantis' controversial law changed. DeSantis signed a law in April 2023 reducing the requirement for jurors to recommend a death sentence from a unanimous decision. Okay, well that doesn't make any sense for what I'm asking. So all that's talking about is it no longer has to be unanimous. It used to have to be unanimous. So if there were 12 jurors, all 12 of them had to say, yeah, we want him to have the death penalty. Now it's 8 or more. So 8 out of 12 jurors or more. So that I know, but why was the death penalty? Is that what they're talking about? That it can only be that? Because that makes no sense, and put him to death. If this is the only reason, and I think it is, so I think that I was wrong in that. I thought at some point they stopped, which I never heard. Hey, D, which I never heard of them stopping that and starting it in Florida, because Florida is an inhumane state. I can say that. I'm from there. It's a horrible state. I don't live there anymore. I don't like going there. That's just the truth. But they'll kill you to get to the next fucking red light there, pardon my language. But that's the truth about Florida, in my opinion. Anyway, I guess what they're saying is the thing that they're trying to say, maybe the grandfather thing, is that not all 12 of the jurors said he should get the death penalty. So because at the time of his act of violence, at the time of his crime, at the time of the conviction, it was not said to be okay for just 8 out of 12 jurors to say, yeah, let's give him the death penalty, and the majority won on that. That's not the way it was at the time. They still had the death penalty, but apparently at the time, all 12 jurors had to unanimously vote on it. Now they're saying, no, you don't have to do that. You don't have to do that. You just need 8 of those 12 people. Any more than 8 or more, and then that can be considered. So that's what the fight's about. And now I'm saying, fuck that, give him death. And I'll flip the switch. Does that make sense, guys? Did that make sense? I'm sorry I missed the poem, because I had to tell you to explain. I had to explain. Your Canadian brain, but you get it, Julie? Julie, it's just, it's not that the punishment changed. It's the way that the punishment can be handed down changed. Okay, I'm glad it made sense. In hell, everyone loves popcorn. How do you know, Julie? Okay, good. I'm glad you got it. I'm glad. I don't think that the Supreme Court stopped the death penalty in I don't think that. Where? That I didn't see. Hang on. Let's see. Let me see. Did the Supreme Court stop the death penalty or capital punishment? Let's see. Okay, so the Supreme Court has had several rulings on the death penalty over the years, including temporarily abolishing it in 1972 for 4 years. It was reinstated 4 years later. So that was only in 1972. We're talking well after that. So I don't think anybody got that mistaken. They did abolish it for 4 years in 1972. You know, listen, I don't have a problem with the death penalty as long as 100% sure, no circumstantial evidence, without a shadow of a doubt, that person committed that crime. I have no problem saying the next morning, bye, see ya, and stop putting money into their fund. Take that $90,000, give it to the families of the people that this guy did the unspeakable to, High Glasgow, and call it a day. He did all of it all by himself. He's so proud. I love the new mic too. Thank you guys. You guys helped me get it. You guys helped me get the mic. What do you think I do with the money you guys helped me get? I do try to put it back into the channel unless you guys tell me there's a specific reason for it. And as you guys know, come tax time, I'll be showing you a few checks to where some of the money from this channel is going to help with some pets. Not mine, but to help with some pets that we're going to give to the organization that I got Danny from. And we're going to help with some kids. I'm hoping that we're going to do with the Justice for Corey, that will be something that we do every year. We're going to give money to people that to an organization that makes sure that people that actually need wheelchairs get wheelchairs. And we're going to do that in Gypsy Rose's name. Not really. We won't give her credit, but we'll make sure she knows how many people are getting wheelchairs because, you know, she took wheelchairs that were needed by people as well as homes and gifts and parties and all that good stuff that she took. After the break, is there more yet? Yes, at 2:00 today, there's going to be the sentencing. So I'm not going to hang out here till 2:00. I got some dogs I need to take out and need to give them some more FOOD. And yeah. And I think it's going to rain a little bit, so we're probably going to go out there. I'm the balls. Is that a good thing? I'm a gay woman. I don't know if I want to be the balls. I'm having a good time with you guys today. And I appreciate you. That infuriates me too. Moonchild, can you hit me up with an email? I'd like to know the company or the place where you went to get the wheelchair. Hit me up at toddy1skip@gmail.com. Please, please, please let me know the place that you got your wheelchair because I'm looking for the place to give our money to. So UK time, please. It's 5 hours ahead, right? So, or you're 5 hours ahead. It's 5:15 p.m. So 0700 in the UK. I believe I'm right about that. Yeah, you guys helped me get this Shure mic. I had that other mic that didn't work too well and was driving me crazy. It wasn't working. It just looked good. I think it didn't, you know, but now this one actually works. So it's raining there in Texas. Guys, I'm going to meet you back here at 2:00. Yeah, I'm going to shut this down. I might take a little nap. I don't know about that. I'm probably going to check on my friend, make something to eat, and take care of these dogs of mine. Meet you back here at 2:00 Eastern Standard Time for the sentencing of Wade Wilson. And I'll probably go online and see how many crazies are outside the courtroom. All right. So guys, I'm gonna say I'll see you at 2:00. 2 hours. In less than 2 hours, guys. In about an hour and 45 minutes, we will be back. We will be back, guys. All right. See you later, guys. See ya. See ya.